Creator, may your spirit and guidance be in us as we work for the benefit of all our.
This goes so fast. Ali, sorry.
Room here today, you and I.
Take it up. We've got qaqallang niarit ka qanuqqa havangmata munarinak WSCC miktaihugai tuqat qanuq munarinearlugita havak pauraaluartuut uqat munarinartuta havaktuatain ilani havakaming nakurakun havalaichit WSCC una Workers' Compensation Board got kanuk tain kanukleka munarinearlugitap got havaktot ukota huma ukota havangneartot kanuk havangmata tain munarinartuta ukota aip ikayorlugitaaqa qanuqleqa ikayornearlugit qanuqleqa ukot havaktot qanuq
cost by using a financially responsibility funding mechanism that is fair.
Piaqo kaming munarinartutap got havaktot ukat havaktot qanuqleqa malerutaliornik piniarlugit munarinearlugit qanuqleqa malerutaliorlugitap got havaktot qanuq Kuyanak. Education, culture, and employment uqallang niaqtoq uqat itqaginaqtut uqat Board of Governors niktai uqat Joe Handley of Yellowknife, Lorraine Tord of Fort Smith, Lucy Kuptan Taktuyak, Rebecca Portman of Yellowknife, Tom Colosimo of Hay River, Jack Rowe of Hay River, David Hurley of Yellowknife, Kevin Antoniak, Fort Smith, Stephanie Earl Barker, Fort Fox of Yellowknife, Richard Boudreau, student, Kayla Gillis, Wanda Roberts, Joey Ann. Tapos ako pinyaligin niya ko Board of Governors. Kanok ikayo naklugi dugod iliha naktot kanok lakay iliha naktot tapos muna kinyaligin niya kahit iliha naktot. Got himmirnialinjerat Aurora College to Polytech University ngolugu. Ili Harwick bakin Fort Smith me. Ukota ka ili chorinak tuktap kota kanokat Polytech 2024 meetup got ili Nektot ihautot kanoka Bachelor of Education tam tuminga pinyeligin niya right. Ukot manito luting ihakanektot nakuniaktok. Ukot kanoka Got pulanak tuktat got Aurora College kanoka hakung na mata kanoka ilihaw tiniak dot kanoka tautuk luit tay habak dot kanok Mr. Rogers na habak para kanoka Munarivlugi to got kanok habaktot. Habakam dauchikun naku galwaktok. Koyanak. Madam Premier, una kakleko kalang yaktok. Caroline Wasnik, una pinyaktok. Got Tauche katimaroka kihunik kanok. Koyanak. Here south kalang nektok.
Too often
Kakti yani hermit nalakto kaptigit matkot kanok ingming yun munakanyaktot tutrikanyaktot ingming yun kanok tamatkot na ilan ni piakalog talaga kagay tabrap na wani herami tam na anakto lakarinik inaurangat dahil na tabra isimagalawak tugut
Social Service Authority includes a population of
5,000 to Inuit tabra ni tabra lo dahil na 1,000 to tiyak tabra tamat ko din na hera mi ito na munakilaw takalugin munakilaw tan lagaluwa kay tagalan tamat ko takal hanakani ito tak hapakrak tot kanok kayok tikraming tabra tamat ko din na hawak tot tabra ni anak to lakari ni inaurangin ni tamat ko anak to lakari di gilok kakaulit tabra tam na ikayok takaw kagalawa kaya tabra na inyo niya kanek hapekralek to na inyo niya kanekun tam na at tailyak kiga dahil nalo tabra hukrailyo ko ting nagalunin hapilya ko ting na habamik tigun tabra HRH tamat ko tabra ni habak to na ikayok takrakilawangin tabra ni Jeremy itot. Dahil na tabra na tamat ko isumagiruni isumagikapki kanolo tamat ko dahil na anak to alakirinigit na munakrirot inyong nik HR HRASS tamat ko tabre isang matigiro ni na dahil na tamat ko na dahil na tabre nyo isang matigap kitap ko habag parak to tere rami ikayok takrakalawang kinalakay ikayok takrakalawang tamat ko noon anak to lakatit ritikun kaya nakokakte tabra ukwatit na inuit oka kaming tamat ko nga na isang matigiraktot kanolo tayo na ilitsara kakpo tamat ko tangong itshot tayo na kanyak to kaptigi din na yung migtigun ko kaktot o kauchiming ni katokto ako ting o kaktot Tabraluptak tayo na huwag matigiga tam na o kauhiting. Tabrani tayo na tangungit siya tayo na tunagalatit na maani inyuni aktuat alani tabra tayo na ptawak kanok isang matigig kami tigit tamat ko at huwamarot naing miktigo no kakto nagaluni ni ako tumingnik pigo mangit shot ilihimarot kanok ang alar sinermik tabralo tayo na taramik tabre ilihawriraktin nalakto ako vlugi nagalunin ilitsokap kaya koblugi tabralo tayo na tunagalani na kinyawanikit na ay choktak matigit tamat ko atin na alat ilihimani vlugit tamat ko hana pagtitakluit kano kilihimak pagtotawk tabre una March nungupan ako lingin niya tabralo tayo na tam na apakrutakil lang na kano hakaw tilangit kano nakarutit mani muna karingiha 2003 tabralo tayo na tamat ko dit na yung miktiwan ka mamakanak to tayo na tawki kayo ko kalwaklo tayo na tabra mat ko haba inuit mani inyuni aktuat tabralo tayo na tamat ko kano inuit kano hilyakad isuatun ang alat takrakagalawa kagay tabralo tam na nagayak tangit parung o kafalar din tabralo ko nanakaktok ting miktiwut tao kanyuni ako minik inyuni ako himing nikilihimarot tayo nalo tabrat tayo ilihimapi ako ting ilihimarot nuna kano kanyak tilakra nga nakarutit kano kulo tamat ko din na nibakto at ilihimagayit kano hekaw ting kanyak tilakra nga man na nunakting tayo naptak tabra kayo iniyakalo ako ting tamat ko ni nga tabra tamat ko din na apakrokulugit kano kanyak tilakra nga taman na tabra nupaya ako apakruta kakaro nga tapti mga minihitawro mo tamat ko nga kaya nunakput kaya nakokakte 5:30 mi vlachak tuharo nga tabra ikaho ko na huwag matingit na kamera kaktot tuhawit ka tabra tamat ko aptaw hawag rakalot na hinig huwag matay sa ako ting inyo na ngayakot pang mapak Mani Northwest Territories ni tabralo tayo na tunagalan kakaway yun ni Mani Northwest Territories ni inyo na akvipting ni natin khakingok powerlichok tarup na utok kananun mat kunungalun utakaoranun na taman na khakingok man pang mapak na 2019 me tamat koti na tutkikarnearnivligit kuleakkangi na tunagalana kehugaluartillugu tutkikarnearnivligit kuleartuat tabalu na huli pangmap 2021 me tabalu utakkiuartut huli tamat kot huli pingaikait tabalu na hanek pangani tamat koti na kamirakakpata ikayutikranik ingnequti qarluartuat tagilan taamna tuharnaichoqqiinarpak qiinaqoqarti tabrauna oqautigillagnialiittigauna tamatkuat municipal community affairs tamatkuat maaninu ingmingni inauramingni qanoq tamatkuati na ittuat 2021 mi piaqluk taqtuat tabraluk taqtaitna taamna na utoqqaoqpailjuni illuatun aulanngaqtuaq tabral taamna utoqqaoqtuaq atukkangati na ingnequgauraq taamna tabrau utoqqaoqpailjuni nutqaqtalehuni tabraluk taqtaitna inugiaktuati na inuit habakniaqaluarigaat tabrap taqtaitna Mani Northwest Territories mi qanoq tamatkuati na oqarigaluarluit na tutqiqqartinniarlugi tamatkuata oqarikkating tabralu tamanna malerutaliaqit na oqaramata tamatkuati na piaqluk taqtuati qanorulugit tutqiqqarniaqutikraangat isumagiraarigaat tabralu taqtaitna tamatkuati tutqiqqarniaqaluaramitigit matkuninga piaqqaolaraqimmiut inuit tutqiqqarniartingit tabrap taqtaitna na inugiangitkaluartoq qaffitchiagaluartoq taman qaffitchiagaluartut tamatkuat inuit tutqiqqaaniartuut tabralu taitna tunagalaani na tabrau qaffalauktunga uqaffaartillakpannga naagaartungit pannngaalu qianarpak naagaartungit paan uqaffalarutin tabraunauми unataimaarautigillangniariga tabraukuatti na tabralu taitna piaqqaolaruati na qanittoq tabralu taitna tamaani na habauttarikamni inyungni tabraukuati na matkuat kavamoruat qanoq ikayornianginmatigit hooq taitna tamatkuati na huaqalungit naagalunin iglungitit na ininuuniarvingit huiñaqormatakihianik huuq havangniararivatigit qianarpak apaqirutaqaqalungaanu nuupayao qianaq Frame Lake min qianaq oqarti tabralu tamatkuat paisikaurат toqarillangniaritka tabralu taitna tamatkuat oqauti kangit matkuat maanin tabralu taitna tamatkuat na qanoq na akipaya ayaqtu tainna hinik piliorpata tamat koi samagluit tamat tainna tabalu tamat koi na parre kakoteng parre tahi tema himmawit lagait parre tamat koi taimak takpata iglaw rangakpata 1 kilowatt ataw himikarni mi atullagait tabaluptaaq tainna uqroqroani kinna atoqoni tabaluptaaq tainna tabauna atoqomiung qanoqqa ikayutiiniaq neepiaqalu piginiaqa tamatkuningautaq itna unnakkingaaqili unnakkiakraungitsoq tainna tabra tamatkuatinna uktoqaqsaqaluartaamna maani NWTimi tabra kangiqqikapkuuna 10,000 ilpait rebate tamanna tabra utaqtitsiniartua tainna tunagalaninna $200,000 tun tamatkuat tabralu tainna maani nunaptingni naatua raungit kaluartu tagalan maani atullagait $10,000 tun tabrauna paqiorlangniaqigia taamna qanuhaqaniartilaaqsangit havaaqpangnik minihtamun
Thank you,
Qinak 2020 mi taamna uqagigalawaqit ka uqaata qanuqa NWT uqaata kigutil nika havaqtit dental hygienist qanuqa havangniarpat uqaata qanuqa kigutinika munaqsiruat qanuqa qanoruniarpat uqaata tangungitsuat uqaata qanuqa ikayornaqqigaluartit qanuqa kigutiti munaqrilugit uqaat qanuqa uqaat qanuqa qanuq munaqrinaqtut uqaat munari kaluaq gaita uqaata inuit kigutindik munariniartuat qanuq piniarpat uqaat qanuq havangniartuat uqaat munaqrit qanuq kigutiting illaqqiniaq patita qanuq piitpantaamna kigutil havaqti qanuqa taapkuat tangungitsuat kavamalgit qanuqa ikayornaqqigai taapkuat havaqtuat qanuqa uqaat hooqa ikayungit patigit taapkuat havangniartuat tainna qiyanaq
Member statements, member for Mumfui.
Yalnaip Northern uqallagniartaq qanutun taapkuat havaguuruat 5 talimanika havaguuruat uvluni uqaata uvlupaka qanuqa mani maningilichut. Ugot havaktot kanok ikayonakirit ugot havaktot hihamanik uvleni havaktot kanok naiklinak higalortut hihamani uvleni havangnakirit. Habang nakiridu si samani ivluni got kanok ikayor nakigalok tuta kanok kanoleka got habak tot ikayor nakigalok tut Kanoka habang mata ay kayo nakigalok tutap ko inuit habak tot at talimanika habak tot naiklinak kirta 4-day work week miktay huay to kan Ugot ikayo nakirit muna nakirit ugot kanok inuit kanok ingilagan tam na hokluk madiheluk pichok kanok ikayo nakigay ugot inuit 16% of people inuit ugot kanok doktor taina hoklung ni ka marihelung ni huna emernik tangarnik tau ka doktor got inyait kanok ikayo nakigaloktot ikayo nakirit got Araki dap got tunir kairat hoklung ni ka hababelak tok inawarni humilya ka ikayo nakibegalok tutap got kanok inyait inyunek to tamani inawarni kanok bagut ingilagan inuit tamani inurat ikayo nakirit ingilagan nakurakun haba inurat aglan ulupak tapkat hoklung nik tunir kail hurat nakungit kalok to kanok ikayo nakirit tapkat inuit kanok tapkat ikayo nakirit araki ila ni tapkat Inuit mani peherut ikayo nakirit pelakalok tut inuit tap inuit humilya ka got inunek tot hapernak kibel galok to ka ikayo nakibel galok tut kuyanak Great Slave Min kuyanak February 25th ni yalno got kekingu belak to ako na got amani downtown youth center me got
and was followed by a hot chili supper cooked by Yellowknife City Councillors Steve Payne and
who
Ben
got Ben
Community
Hentrins,
members went out not only to walk and raise funds, but also as volunteers to register walkers,
who got kanok le kai ka youth leading tap got pihu ka doctor kanok tut kikakner lugi tap got
tens of thousands step outside the warmth and comfort of their homes to shine a light of
who
love.
got kicking ubi rahmata mani
Light of the Year has raised over
2011
across Canada,
who got
66 communities,
maning nik
remaining local to support CNOY charity partners. Sponsors of this year's walk included
who got pihu ka doctor kanok maning nik pinyak luting
Quality Furniture, NWT Brewing Company,
maning nik pinyak luting pihu ka doctor vani yellow knife me.
Mr. Speaker, luckily for those walking on the 25th, it turned out to be one of the warmest evenings we had in February.
We got February me tap got February 25th me tam na una kigaloktok na
Climatic conditions experienced in Canada, and for the longest duration.
we got kanok
Housing, lack of services, lack of shelters. We are only seeing
we got Inuit I'm a Richard kikingok parang mata nakungit kaloktok Inuit Inuvialuktun nagalunin pihutakto tayo na mani inyuna footing. Ikayo nakigalok to tap got pihukataktot mani nunap nunami mani kanok in the streets. Okay. Kinak. We got kanok atani nunam habaktot kanok ikayo nakpadi kanok habang matatap got kanok. We got federal government ikayo niya kot kanok habang matatap got nunamatani habaktot 31 tun 5 being out and talimatun got habang niling niya kot kanok ikayo naklugitap got kanok leka inyu kaming inyu nak ikayo naling niya kahit kanok leka hangarok pang ni ikayo rurat kanok ikayo naling niya kahit got kanok isalong ni ka atulay atok atong nangin niya kot kanok hilak puta nakuhinyak lugo kanok got kanok got nunabatani habang niyaktot kanok nakuro kun inyu hik kanok tutkikak niyakluwit tap got kayanak. Nahanday min. Got Irene tayo malingin niya kok got Liard, Fort Liard Health Center mi Irene Taimaligin Yakok Kanok got Liard River meet dot got Kanok inyu hinga Kanok laka inyu neak takuna ilihakan lutin kunip daw ka humili ka Angus MacLeod got tap to ma nulian niya ita nulian niya tam na angun Irene kanok lekay niyo na akliting na nakura kina got kanok lekay inyo na akliting pigalok tot got nitakaligit kanitin kaya kanok lekay niyo na akliting umiyak pa kun nagalunin kanok lekay Irene tam na pirok tam na Wise Woman Award nektay hugay to got kanok kanat pirot Irene na February 5 ni Irene Taimaktok Koinak
Sa Batchamin, nalunaran lang nalit kahit matkot pulak kahit maunga. Tabra ilan na kaw na. Kulalaw kaya maunga pulak man. Kaya gibliwa. Sa tumin. Kaya nak. Tabra kwat Edith Widow, grade 9. Tabra tam na grade 8 tulitamin. Tabra kwat mani hawaraktok ikayura kalit. Tabra kaya una ilihimat ko lolit kaya ilit kumikyak kanok ang alaro tiptingnik mani habakapta. Hibun niya kawik pang mi. Tabra Australia manukot kairot kaya ilit kit kamao nga pula ang mata. Kaya mani huli sa Batchamin. Kaya nak. Minyitaw ako na makamin. Matkot na piakluk taktot inuit iniming ni kanok isang matigibihiw. Kanok lugilyo. Ikayo ko niya kakaibihi. Tapkop takto tait na kanok iniming ni hura kakamata. Ilitsa niya ilihiman niya kakakibot. Tait na lo kanok kataw herkihianik tam na nunangat ing miktigun. Tabertam na ikakaklu man na nunagput Canada mi luin tamat ko dilokanyik at tawlugit muna kanya kakibot. ilihimane aqivut tamatko.
Mr. Speaker, can the minister explain why tornado
Minihitam kolella banguna. Tamatko te inna. Piakkoila ruot. Piakkoila guming inimingni ini nunamingni inna. Hunik ikayutikranik tamani ilyakehemabat. Ukakti. Tapko tapko kitna. Ataw chimituk ikakaklugo mana Canada-mi. Kanok inuitit na piaklug takmata piakkoila mata tabrata matkodi kayut. Ikayuta kaktugut uwa tigun. Tabralutait na. Kanokulu tamatkodi na ilitura kanagit. Kanokoti ilitura lata kaklugit tamatkod. Kanokoting piakkoila tilangit nagalunin. Ikayuti kirangin ilitura kainyak Tamatko tabra kafirut. Tait na tabra tait na. Tabra tait na tolog atam na tolog ataw hek. Inyu nunamigun na piaklug tak toak ininga. Piakkola roak tam na tabra ataw hiutangit pihigi. Tapi ikakaklugo man na ikakaklugo Canada kanok ikayuti shrepting niki ilihimarugut ipagut takaktugut. Ikayuti lagubut tamatkot. Kuyanakpak. Ako likra nga tu mapakruta nga. Tabraw na uperepiakpiyo. Karolo tamatkodi na ikayulla batigit na kihulla ka piakkoila roat nagalunin kanok hapakaktot ki inimingnig tutrik kanyaktot. Kuyanak. Tam na tabra. 2021. Tabra tam na. Ini magigput. Kanutun tamatkodi na ulek pagtot ili magibut. Tait na lutabra. Tait na tunaglani na piyakko tamaw na iningi tit na hekamin matigit. Nagalunin inyunervi lautanga yakmata. Ikayuta kaktuutap muna. Here we're south. Kuyanak. Apakruta kaktakunaptak. SHSSA. Tamat ikayo takakpat ikayo takaktoting nik ilihimarunga. Tabralo tamatkodi na. Tabra ataramik tait na. Taman na alangulait pailugi tait na ataramik tam na atokakigat ikayuti. Kanokolo tabra tamatkodi na. Tabra tam na atawhek tam na tutrikanik kumiyong igilyoa tuglea tutrikalabaw. Nagaluni atawhek takpat. Kaya nakpagkakakti minita ko na. Kaya tabralo tait na tunagalani na taktinguluran pichut taktinik ilihimang ichuanik nagaluni nalapkahuktonik tait na hinik taktakakpat taktichut. Tabralo tamatkodit na ilihimarot na munakrawrat tamatkot iglungin niya. Tabralo tait na. Tapkot takti atawhek kihenik tawtuyak taigat nagalunin alamik taktimik tautokulait kay tay na lagi kita kalugit. Kaya nakpag-doctor ni ukadlaklu. Kaya nakwakakte. Tabraw kwat tay itna. Here me tay na ikayok tikraming nika kokola rakaktut. Ikayok tikraming mingnik. Ikuhamik, ikuhatun, itsuktut. Itkugay tamat kwat ikayok tit. Tabralu anak tola kiro tabrani. Kanakulu tay na ikay awlak tita tikrangin nik. Hilatani NWT min. Kanakit pa tamat ko tamo nga hilatanun awlak titsakto ni. Kaya nak tamat ko din na tamat ko anak to lakarit an uniok takalugit na iwaklilay chut ikayok tikrangin nik. Tabalut tawak tamat ko din na tamat ko hibuan nakakaruk tamat ko nga hibok pangani tamat ko ikayok na takrat tutkika naktut tabrawa tutkika lilay kait utak tichiniak to kinyawaranik tayo na awla to tam na tap tuminga atulay chugutay na habaw tapting ni. Kaya nak okakti Herber South. Kaya nak okakti tabar tamat ko dit na Herber mi dit na HRSS mi tamat ko dit na Huichut HRHSSA tamat ko dit na malakotali akaktut malakotali amit mat ko tabraw kauti kapang mapak tabralo tait na tunagilan tait na kanok HRASSA tam na ato ko na aktilak rangat kanok Herber South Herber mi ato ko na aktilak rangat tam na kanok atutik rangat abray sumalugi tam na kakti kaya na ko kakti NTHSSA here tamtap ko anak to lakrinin ikayuta himarok tam na tabra kanok loy sumati tam na ilokating na kanok na aktilak rangat kanutik raming nikay sumaluk tutap ko tabra lo tait na lo kanok Herber ikaw dun angalan ni aktilak rangat isumati putpang mapak tabra inyugek to na inyugek to ni na allako ni na ikayok kamanayaki utap ko kaya nako kakti tabra lokata tabra mani na munakrero at anak to lakinig na taman na ito atun pingarong naktok tabraw na Herber una kakay kapinig tayo 5.6 dun na FEE dun tamat ko din na tabraw tayo na tay na altihong naktukot yellow knife dun na muna ka nakabatigit tayo na ati hivlugik tabraw na Herber kihimi tabraw lokating tayo na taktinik na taktilyok ko ding tamat ko din na ataramik piraktud mani tabraw tam na nalupki piyaki una tabalutay na kanod na gala tamat ko taktit tabrungak titakanay kabut isumatigigibut tao kataramit dahil na atigibligid ang alat siya niya aktuwitin yung nik. Kaya nak.
Sir, oral questions. Member for Nanakput.
Thank you, Mr. Speaker. Today, Mr. Speaker, at 5:30 a.m., I received an email from the Minister of
Minister Archie min tuharong tap ko na huam matitam na generator at tayo na tayo makatakan ni Blue. Tamat ko at aula hisagutit kagilugo isumatigalo kaya tam na ikahong mi hapakraktot. Kaya nakpag ko kakte. Tawa ataw chikunin na matko dili man nakakibot kano harawtit tamani. Inyo na aktuatit na muna kanya kakibot taw chikun. Tamat ko at pabaklo ko na utimuk tita kaya tiyuk tayo na habang nakalaluwit. Ilan ni tamat ko at pabaklo ko na nutkak tita kaya tiyuk. Tabalo tayo na tamat ko at na taman na generator at na ing nakagawrang at laktit kalo kaya ikayo tamat ko at habag tahalugit tamat ko dahin muna krero at tayo na matinik tabalo tayo na hinig tawa Norman Wellsman tawa tam na tikin niya aklugut tawa ubulumi tabrunga tikit chot tayo na kating utak tabalo tayo na tap ko kati mikat kating mirolo waktit kano kangalaro tingin niyo kilitso kanya aklunga tabalo tayo na kapinik klak maong ikakane ko na aula magay tamani na aula ikayo lakanya aktuanik na ilan ni tabrawa ulakta tuting mirolo ikayo lakanya huting inyong nik inawara niglo kaya nakpag tabertam na tayo na ito nagalanin na pinakrakangit kalawak put agilan kanut nagalan ubo taman na taber tayo na ito nagalan hakan nagalan tam na utak kanyak pitakan ito nagalan taber tap tumain na February mi taber tayo nakata tap tuma puwakla ko nimnut kakti tekang atigut tayo na tam na pahiraong kalawaki taber pahira kaya agla tayo na taber taber ni puwakla ko nakpawra ka matain yung episode taber lut kano hinigilo kano hitya himawit kakpat tamat ko at huamatit tamat ko at na 40 tun aglanin nakakangone aktok tabrani ikahong mi tabrani huamatit na habag tingat habak pangnikin na tabralutay na tabralutay na ilokating ilokanyik tayo na sagutit kiktakto tam na huamatingat ilahakabing ni nagaluni mo nakarawra kakabing mi tabralutay na tam ko ang aulakit kiktok tam na ing nakagarak huamatinik aulat siri nunakput qirak qiyak pararik pitara minihitaraintin.
And I just want to make sure that, Mr. Speaker, that August 2023, that generator is up and running and no more excuses. Thank you, Mr. Speaker.
Thank you, Member for Nunukput. Minister responsible for Northwest Territories Power Corporation.
Very much, Mr.
Qiyanaqaqaqti taruukut iloqatatait na ikaarnini havautaaqaqtugut havauttakraqput ikaarnini ittoq tabrauna qila meqroqotait natamatkuatut qiqaugaloarlagit tabraukkuat tamatkuat agraqtit umiarpakpait tavrungatikinerilluting tabratait naquta taamna himmauhingiharput tikinerilluni ikaahungmun qiyanarpak.
Minister for
Ukot kanuka ingniqut liwit tapkot paisikaret kanuki kayornak pata kanuka tauqirniaq mata ukot init kanuqleqai kayornak tapkot paisikarenik ingniqutiligit qiyanak. Ukot kanuka habak pangnika munakri. Ukot kanuka uktoarnak kanuka pinyaraloarit put aglan kanuka ikayornak kanuka tauqirmatainit kanuk rebates niktahugait ukot tamna pinyaray to kot rebates niktay tauqirmata ikayorlugit. Ukot e-bikes niktay hugay ukot ingniqutiliwragat tapkot paisikarat kanuk habang mata nakuniak to qiyanak. Ukot kanuk kanuqikayorniaq pati tapkot uqallangnerit ka Arctic Energy Alliance namna kanuk hangaroq pangnikir ikayorti. Qiyanak. Hangaroq habak pangnik tamna munakri. Ukot tamna uktoarnik kanuk habangniaq patapkot e-bikes tapkot ingniqutiligiwit tapkot paisikarat. Qiyanak. Frame Lake. Qiyanak. Yukon mi tamna tapkot ikayulingin niya $750 and $1,500 and tawk kanuk ikayorniaq pati tapkot e-bikes nika atuktot. Ukot tamna ikayokti kanukuna about taigalorin puta ukon kunaptauqa tauchikun about habakalorin putamna kanuk tamna ikayornaqluk Piniaralaarik puta uktoornik taamna qanok April 1st mi taamna isakutiniartut qanok taapkaat qanok havangniarpan Kuyanak Frame Lake min Kuyanak Minita ko na uktoortiniariga e-bikes niktaina Paisikauranik Inniqodiligauranik Mani NWT qanok ikayornaaqpati taapkuat rebate-nik qanoqa ikayornaaqpati taapkuat inuita maani nunaptingni Kuyanak About taigaluarik putamna qanok Arctic Energy Alliance tauchikun about taigaluarik put una MLA qautiniariga qautiniariga una Trinidad walite una Kuyanak Ukat honorarium maningnik ikayuniartuting ukat anguniartodukot qanok ikayornaaqpati taapkot honorarium taihu ait maningnik aichornaqigait taapkot anguniartot qanok qanok habautarniarparungtaan qanok ikayornaaqpating taapkot anguniartot init Kuyanak isiani taamna munaqri ukat qanok ukat qanok maqiranik ikayuniarluting taapkot taigurlugit taapkot qanorleqa ikayornaarlugit qanok havakkaluartugut taapkunanika ikayuiñarlut ikayuiñaq Kuyanak taapkot government kuta inyuniartot qanok inyuniartot ukat anguniartut qanok pivagit qanok ikayornaaqpati qanok inyuniartot taina Kuyanak ukat qanok ukat tangungitsot habang inyuniartot qanoqleqa anguniartit tauqa inyuruartaina nunaptingni qanoq ikayornaqqigaluartut ikayornaarugit kataina qanoqleqa Kuyanak qanok tutqikkarniarpati taapkot qanok inyuhiqtingnaagalunin maningnik aitsufaarluting lukit taapkot anguniartot taamkot nunaptingni inyurot Kuyanak uqariugit ka taapkot inyuita kanore ka Inuvialuktun mani nunapting ni kuyanak. Today holiday. Kuyanak. Tauchimuna katimanertu kanok tutkikarnerluit tapkot kanok ikayornerluit tapkot Inuvialuktun mani nunapting anguniaktut lunni kuyanak. Isi ni una tauchimuk kukkaloari tukut katimaluta kanok kariluitam na kanok ikayorner luitap kot inyu taina inyurot kuyanak. Oh. Kakti. Ukat Inuvialuktun. Real loud.
Okay.
Ukat kanok Health and Social Services una kallang nektok. Kilang nera 20 tapkot tapkot nursirat Inuvialuktun kanok 20 tun hamma. Kuyanak. Cam Lake. Kuyanak. Uku taiku tuhakap kutam na kanok ikayokluit tapkot Inuvialuktun nursirakun. Kuyanak. Ukat kanok ikayurot malukutil ikayurot tapkot kanok nursirat time Inuvialuktun kanok habang nektot kanok ikayornak kuyanak. Kanok
Services.
Thank you, Mr. Speaker. Mr. Speaker, the point of having the LPN program there is to provide a local workforce for the functions of that it will be complete in time to offer the LPNs work in the NWT. We need them. Thank you.
Thank you, Minister. Final supplementary, member for Kamlik.
Thank you very much, Mr. Speaker. Mr. Speaker, I absolutely agree with the Minister.
Kuyanak. Ukat munaklit healthcare system mika taihu gaidukot munaklit anartonic. Ukat Health and Social Services na kiulang naktok. Ukat munaklit anartonic ukat munaklit nursirat taina habagurit kanorleka ikayunyakluting. Kanok habang mata ukat nursirat ilihanik mata kanoka habak tinira ko hit tapgot mani habang nira or mani nunapting ni kuyanak mampuimin kuyanak kakti kanoko got lungnik tunio kai huro kanoka ikayonak kirita inaramni kanoka palihimatu got ikayonak kirita got inyong niktap got got kanoka adoktor tayo na hinika haklong nika kanoka ugat minita ko na health and social service nika unapta kayo ihurok kanoka ka ikayo naklugitap got habernya to habernya to habak to taimani ugat tangichot government kanoka kanoka habagur but kanok palimat tao ka tangichot government lo kanoka habagur but tao chikut ugat kanoka habang mata ilihemane arugut kanokole kai kayo na tugitap got inurot inaurani got kanoka palihimatap got ikayo niya hurut tap taina tangung chot out government ngita ikayo niya hurut palihimallo ugot kanoka mampuimin kuyanak taiko kiukam nga tayo naguro ako kuyanak ugat tao ka palihimat tao ka habang nakirita tap kalo inawar ni hibon niyaktit kuyanak ugat tao ka kanoka kanok habang mata padihimat ugat kanokole kapekroy hurit kanoka habang naktot tap got inawar ni kanoka habang niyakpita tayo na apekroy hurit inyong nika tap got inawar ni itot unap tao ka kanoka pinyarurit living well together nik tayo hugay tam na kanoka inyong niyakpita tao chikun kuyanak ugat kanoka habang nakirita tao chikun kanoka tap got okablugi tap got haklung nik tunia kai hurat kanoka chakinak kigalok to kuyanak ukata ubagut week ukalauti like kikputap kotinyuita palihimatau habang niya kaming kanok Inuvialuktun Lake so kalang niya to kayanak tam na kapapikri niyang niya Health and Social Services kanok
tapra anak to la kaya pero lang dia kaya. Kaya nakakakti. Una anak to la kaya nigminhitarak. Tabalo tayo na kiyo hakirot din na inaural ni tayo na ilokating tayo na kan ilihimarot sa kanoemik habakraming yik. Aglan ila niptawag tayo na kapitsegurut na mga habagyak takoting pilaychut mane habagyak takto din yung tukalawak aglan tayo na tunaglan hibikutsuami mani tektura kaktot hitay maulakoting kaya nako kakti una tabra pakruta kikatam na tabra lutay na utero matay na ilitsura fanek tungay na katimakatinin inuit katimarakaktua tay na ilitsura niyakit ka kanuhakautigim magay tatamat ko tabra tay na awalaktin matigit tabra ataramik awalaktin takigay tamat ko nutakhatin na nagalunin inyay ting miktigun awalakan yaktot tabra tamat ko din na munakirakra kalawangit at kilamitsura niyak tabra laptak tayo na awalaktin takaluit awang haruk awalaktin takigay kiyo titing na kamilakewakayakluit na ila ni halum makabluit kiyo titing pirakigay tayo mahin awalaktin takigay hindi tabra halum makanayak patit matigit kiyo titing kaya nakpag tabra tam na pakruta nga nakuakipiyakaya tabra tap ko at kabamatupan ito at kaya na tamilyo ikakakalawa man na ilingita isumeo ko tigirakigat kaya nakpag Inuvialuktun Lake kaya nakakakte tabra ilihimarunga tabra una ilihimapiyakaya kanok ang awalakta ko magayta tabra lutay na NIHC tamat ko na pakawakakapke na munakrirot tayo na kiyo hekilirinik ilitsurarakto nga tabra tamat ko nga tayo na kanok awalakti ta magayta at taramik tayo na inyuga kibay chok taman na kanito nagalan kinyara katok to piyaka tamat ko awalakti takalawit kiyo hekiliriniktot kiyo hekapkay niyaktot tamat ko at nutakkat nagalunin niya inyat halumay niyaktot kiyo tingin tabraluptak tayo na taramik tawak tabra inawara nun na tamat ko at kiyo hekiritay na awla lakta ko galawaktot pag mapag awla ka nga ekot. Ukakti tabraw na anak to alakirito na kanok ang alarating at ukaw tigil lang niya kaya. Tabrauna tabra umani tatkakauti minunguneaktok kanuharautingat. Kuyanak. Inuvik Twin Lakes. Kuldekranga. Kuyanak. Kiu. Tabrauna kanok. Kanok hating tamat kot kanok isumatiginak per isumatigi warung uko GNWT Kabamaurot. Kanok lutay na tunagalan. Kinyaranigi na atu tikraming ni kanut tunagalan ilicharabat ato na aktila kraming ni. Taraptak tay na tunagalan. Tamat ko na tamat ko na ilichara niya kamilarao matigin kiutini kamilarao kaming tap ko tabra akin nyak para kaktut tamat ko kiu hekirit tabra tak NHG tamat ko namun tamat ko kinyawanik akiliu tikrangit munakiboti una anak to lakadini minihitawrak kaya na ko kakte o kakte tabraw na apakirtangi uma nalapkagigit ka kanito nagalan na humitilangit tamat ko kinyawarit akiliu tingit kaya nakpak tabraw na tamat ko na hawak tichirat tamat ko na sisamani ubluni hawak tabalalik opta nakuni yaktok mani kuyanak o kakti tabraw nga kalawakili tabratam na tabraw lutay na kanokulutay na tabraw langit sisamani ubluni hawalagalakit uwangap daw ka 17 ubluni hawak to alarunga tamat ko agalan tabrap daw tayo na tunagalanin na tamat ko na hawak to himmaw hektakang tamat ko hawak to tayo na tunagalanin pingahuni ubluni hawalahi lugit ilingit tap ko pek kamal habang ihalak patata tabra iningit iningin ni hawak to kayaktot kaya na tabra tao ko na tabra 40% tun tayo na tunagalan taktit tayo na ilit tsaka rugut tayo na tunagalan taktil yuwak to at mani tabra wapting nagtaw ka tayo na taktil leo kalawak na yakaktak tonik kaya na Yellow Knife North me. Muna kariro ako na. Minihitang at anak to lakarit. Twenty mi tabra tayo ukwad o kakatigim mi kangit kutsik toani ilihak toat mani nunapting nin kanok ikayulam magayta matkwad ilihakanak toat tamat kununga takting o kanak tonik malagok tayo na tabra nachirakaktok takting o kanak kami tabra na tabra tamani nachirot namani ilihaktot tabra daw tayo na 14 tun na ilihaktot maunga kanayaktut tabra luili tsakap kanyaktut tamat kunanin ili anyakbing анниарвing нина хитамилиараниарути анниарвing нин илиарани илиартуаттаматкуат хавангниараниартуттаа қиянарпат тавалоқайник тапкуатаватайнахооққа қаратсуулингит пати таматкунингаа килиаксаниттаоқ вактингин қанарулу тавалутайна тунагалаанинна тавалутайна маани Northwest Territories ni na қаратсуулипкаит қунгитсут маларунниуккиунгни таватаматкуат малахиникин на атулларут ханутун икаюиллага итаматкуат тайна малахитигун қиянақоқарте таваптаартайнат нагалаан тавалутайна тайнахиникфули илихаравингник пиитсугут маани тавалутайна таматкуатинна қаақил чихуккалуартугут агилаан таматкунингап таукииняраник инақорортугут pangmapakahin ay tay na kanito nagalani na maunga ilitsyon niya na aktugot kanito nagalan maunga ilyam magaita result kaya nakakakte
From an act book, but kind of tweaked my interest. So I've got a question for the minister responsible, either infrastructure or NTPC. I would like to know, ask the minister, what immediate electrical backup or supports is provided to residents in small.
tayo naluto mo na nunakput ako kalaktuak tamat ko na huwag matitigun kanut na galan huwag matinig na ikayuta kakpihin na warlanan Northwest Territories kaya nako kakte tabray langit inaurat tabray lutay na allagigtut kanuhaniluk diesel okrokoronik gasolinik tamatkuat allagigtut kanok angalarutingit atutingit tamatko angalachinya kaming tamatkuninga tabray lutay na kafe kwa kotingit na nanakilyarak naningit kami nakakoting. Nagaluni huwag matingin nut kakta koting tabrani damat ko tigilurang iti ingnak tulakiringit na tamani itkalawak tilugit yan na kami nakakaktit huwag matingit. Tabrabtak tam na apasutarik ka Kano tam na miki alawak tilugo. Menyihita ko na. Ilangit tamat ko nga generator rakakaurut. Ingna ko rakakaurut ing mikti ko na nakakto ako luting. Tabalutay na ilan na tumatkot atul lambagay ta apasutakid lakikitam na. Northwest Territories huwag matingit sa minihitingat. Tabalutaw ilokating tayo na. Ataw hiutaktud tumatkot inawala na kanok ato kaningat taman na huwag mati. Hiliharabilo anak tolak rini na munakrawat igilungat tamat ko ta munakahugibot munakirabot tamatap ko ka itkagihugibot kami nakakaman tabraloy pangmapakil Kolaktok na napaylakarniyak ni Biluting ay makabisirang inyik inuit. igilukramingnik nappailaqartuat inugiaktut tamatkoda tullamagaita perruuttarigiataamna Huyanaqoqarti tabrauna tabralutaitnatunagalan tamatkuat tabrauna taamna tabrauk taitna piñaarnilugu piñaangitkiga uvanga ilitsuqeramnik naagaluuni piñaarni kara una utterlungaahi taamna oqaqatigilniaritki tamatkuat apeqruiraartuat taamna tabra taitna isummatigikapku inaaralaani ittuat taitna ingmiktigun taitna huammataqaulaquming nakuunayartut ilaatni tamatkuat nutqartarmata huammatit qamilaraarmata imatkuat nanniingit taitna ikayuutaunayartoq taamna ingmiktigun generator qaruming ingnequgauraqaruming tabralut taitna inugiaktuat taitna nagalaan tamatkuati naaqapeqertittarigaat tabralut taitna haullaqtitairuni iñungnik ilihimaruanik taitna tamatkuninga havaktukranik ingneqi euruanik ingnequtitaahit tamatkuat ilihimakkangita akihuruq aullaaqartitluni iñuit tabra iloqainit maani 3 pingautitluuni sisamatulluuni percentun tainnatunagalaan tamatkuatitna tabra tuhaahulaittikput taamna tabra uktuaqqimarugut pilliautaqaniaqquta qilamik tabrauvaa tamatkuat tutqiqqaraniaqarivuk
Mr. Speaker,
apeqruhiukkalaartungana qaneq 1.8.2 qaneq taapkuat havaktuat qaneq contractnik taihugait qaneq havakpatataina governmentkut qaneq taapkuat havaktuat contractnik taihugait ukkuat qaneq havaguvat taapkuat in ukkuat 1.8.2 taapkuat number 2 qaneq havak 1.8.2 brackets A qaneq havaguvat taapkuat ukkuat qaneq tallimat 1.8.2 Cam Lakeman.
thank you very much, Mr. Speaker. Mr. Speaker, I have a written question here entitled Sole Source Contracting for Northwest.
Ukkuat sole source contracting niktahugait ukkuat qaneq havangmata ukkuat qaneq havakaming
The GNWT can enter into sole source contracts based on narrow criteria.
ukot GNW tip daw ka pilyarut kanok habang niya kaming tayo na. Ukot Health and Social Services contracting tayo gay tayo na ukot Health and Social Services kanok habang tinakluwi dinyo kanok habang kaming tayo na.
What is the rate of sole source contracts awarded under criteria 1.8.2 bracket A that
Kanok habang tayo hugay hu kaming tayo na habang mata inuit.
And 5, given a significant amount of sole source contracts awarded by NTHSSA under criteria 1.8.2 brackets A are largely for training goods and some ongoing
Kanok habang niya kaming tayo na kanok pihubat kanok sole contracting ni tayo hugay kanok habang mata ingmingnik kuya na. Kuya na. Ukot kanok ato kumata ukot ukaut shifting nik kanok nekbat. Ukot kanok kanok habag patap kot kanok kanok habag patap kot ukaut shifting ni kabak tot. Kanok habag pat kinyarakun nagalun kakihaurakun habag pat kanok tayo na kuya na. Frame Lake min pilyang nektok kuya na. Tap kot ilikilakulawi ka model bill. Tap kot akilifakrat carbon tax mik tayo hugay tukot kanok pinyakpat. Kuya na. Mampoimin. Kuya na. Tam na pitkuga loakiga nunyariga una government Northwest Territories tap what ukauti hukaloa ukautit kukalorigat ka tap kot kanok igilunik habak tot. Ukot inyay 60 and over. Ukot inyu rot mani nunapting. Kanok akilyak paurakanak kanok ikayokanak higay tap kot inyu ita igiluni tot. 2023 mitam na hakuta hukaloarit ka hukot ikayokanak lugitap kot inyu ita akilyanak tot kanok akit
Member for Mumford. Notice is a motion. Notice is a motion. Motions. Motions. Notice is a motion for the first reading of bills. Minister responsible for Environment and Natural Resources.
Tamna ECNE tamna kalangyak minitak March 8, 2023 Bill 74 tamna pinyagat tayo konegat
Notice is a motion for the first reading of bills. Government House Leader.
tamna Wednesday, March 8, Bill 75 tayo konegat ka pipka neriga tamna
First reading of bills. First reading of bills. Minister responsible for justice.
Justice mi tamna pinyaktok minihitak Bill 72 tamna opioid nika tap kwat hoklung nika or marhelung nika pinyaktot tabacha nuchukaloria una Bill 73 kwat kanok kwat tayo onerat hibulivlug
First reading of bills. First reading of bills. Second reading of bills. Second reading of bills.
Bill 23, 29, 60, 61, 63, 66, 67, 68, 14-19, 43-19, Brackets 2, 45-19, Brackets 2, 681-19, Brackets 2, 649, 813-19, that Brackets 2, and got
Given to me as Speaker under Rule 2.2 Brackets 4, I hereby authorize the House to sit beyond the daily hours of adjournment and consider business before the House and member for Inuvialuktun Lakes.
Inuvialuktun Lakes Pinyaktok. Got Frame Lake min kalang nektok. Kaya nak got 813 19 Health and Social Services tam na okay kukaloria kaya nak tayo malang nektok ano bifar nektok kaya nak
I'll now call Committee of the Whole back to order. Committee, we've agreed to consider table document
813-19, brackets 2. Health and Social Services up o kakaneaktok. Fiscal year 2023-24. $15.5 million in hakutakanekait money. $21 million in about takanekait ugat kanok hinigwing ni ka pifa including unnerving me. Got kanok pifa nerluit tap got kanok ikayu fa nerluit init unnerved kanok ugly nerluit kanok ikayurat kanok anektonic. Got kanok maniranik maningnik adoktor kareait. Got kayo kuligitek what nutakait.
Representation.
Got habang naktut kaya nakpet. Isirihuk pit ikayok tiksakanik. Isirilagin ikayok tiksangingik.
Minister, please introduce your witnesses.
Thank you. Elizabeth Johnson, Director of Finance, and on my right is Joanne Giacchetto, Deputy Minister of Health and Social Services.
Thank you. Welcome. Does committee agree to proceed to the detail contained in the table document? Thank you. Committee, we will defer the departmental summary and review the estimates by activity summary, beginning with administrative and support services, starting on page 190, with information items on page 191 to 192. Questions? Comments? Member for Yellowknife North.
Yellowknife North min? Kaya ukakti. Tabraw na atuwak episode takilang niyakiga. Kanito naglan atuwak magayta. Inuit ilit
and what we then expect that to bring the total cumulative deficit to. Thank you.
Ilisakap kalaban nga ukot atuwanik. Ukiumi umani. $33 million tun tayo na tun naglan. Nalap kayo ukto naglan pang mapak. Ukiupak kanot naglan. Kanot naglan at ikaw kakamagayap ta. Kuyanak. Yellowknife North Min. Kuyanak o kakte. $200 million dun tawtung nakalawak to ko na. Atuwak. Tabraw na isumati ina. Pero takil lang niya ki kanok kanod naglan umani ukiyo una ukiyo agpakop tigo kanod naglan kinawar ni pekakanak tilakrang di suyak bilag to. Minihita ko na anak to alaka rin eh. Tabrap tao ko kwat. Tabralutay na isuato na matkot ikayo na akluid. Ikayo na akluid matkot anak to at tamatkoluin na ilyakehiman ako tamat ko nga munakraudat igilukrangin yik. Tay na lutabra. Tabralutay na tawak tam na atuwakit na atuwak aglin niya lay chok. Tabralutay tam na Deputy Minister kiula hong nakatin. Kuyanak. Tabralutay ko tabra kiwa na yung naka-uminga. Yellowknife North Min. Kuyanak o kakti. Tabraw na nutak ay shooting at uwapting nun at utik rakpat kutsik to at kamamat. Federal government nagpilakigay tap ko ay shooting at uwapting nun na at utik rakpat. Ato ak rakpat ukiw tigo. Tabrap tao kilitso kayo magiga una that dahil na tamat ko din na atuanik tabot nagalunin kalli kanyak tilakra nga una atok kabot $11.9 million dun $9 million miktaw na nutak tam na tayo nito naglaan itok. Tamat ko lo pilaktuin mata tamat ko tabra hakpak kamagay na tamat ato krakting tayo na tamat ko tao kay na ikayo niyak to atin na ikayo niyak to tamat ko nga tayo na ilaw kibot tamat ko tabralo tayo na Canada na apakalig rotit na lo okalak to at pinyakan ni Blue tayo na tunaglan. Iling ita malako taling itin na tayo na itik. $11.9 million dun. $200 million dun tok tam na hibihuro makin takiro makin na takihung naktok tam na atugangat. Tabra kapinya ukiyo ni tabra tayo na ilitsara nga. Tabra tamat ko na atok tangit mga inip territories ng atanami inarit kalawak tilugutay na mga ilan nitak pa mga hoting tamat ko akilirak to tamat ko nga atok tanik takpa ni nunang itapting ni $33.7 million tuntay nito naglan tabalo tamat ko na hibuhirami kat habag to ni kit na Havaaqartut ikaarniñiqqaffini havaktussani taimmahin taamnanaannamilung itna qaffini ikaarniñi havagartut taamnaqallerlugu qiyanaq tavrana qaffiniki na avektuarlui na ilitsarihukkaluarneriga taamnaqqanoq avektuarumiung na ilitsaripkarajaraanga qanoq qanaqatoquniartilaallaga tamatkualui na havaanikkaming eitun han ikaarniñi naagaluni toornik naatilviuting taitna havagartulila niptauqitna hivihuihisartoq taitna havakkaming havaangita taamnaahin akiliuhiakrangat ilitsaripaloki qiyanarpak tavalu taitna tavalu tamatkualit na aviktuaraluit taitna ilitsariniartangitit naaviktuaraluit ilitsaripkallagivut kamlaikmin qiyanaqoqqaarti taamnatauq Stanton tavrani qanuherautinga naagaluuniin angalarutinga tavraniinniarpaa miñigitaq tavalu taitna tamatkualit na ilauru tavrani anniarvingmuglugi taitna tavrani inniartuat utoqqanaatit na ilauvlugit aahin tavru taitnaqquting taitna tunagilaan kiiñaurartaamna atoqqimaruq qiyanaq tavrauna apiqruuttaqimikkara tavrauna apiqruuttaqa itna qanoq tamanna itna allanguarava manna maanga anip maanga Northwest Territories nin atoqtaq takpavunga huli taullartit tuni inyuk takpavani huli takpavani itna Alberta miljuni takpavunga allamununamuni naullartillugita hitam tamatkuat kiiñarat atuaqrat maani Northwest Territories ni takpavunga Alberta min naagaluni allamunnunamin atoqhamitigit qanoqitpa taamna ilitsoqiliaukkiga qiyanarpak taamnaptauq qaqaharatiuni ilitsoqinartoq taamna ilitsoqihukkan NWT maqanutunagalaan atoqtuat naahit uanga maanga NWT min allamunnunamun aullaqaming tamat qanutunagalaan atoqtilaangat tavalaptauq taitna qanutunagalaan utaqqiñiqtauq taamna ittoq tavrani taamna tavra qanutunagalaan itna ilaani tavra utaqqiñiqtaamna ilaani huamahihuuroq qanoqlu taitna utaqqiñiqta innaurani aullartitkaluarnagit tamatkuat anniartuatitna ilaani taaptuma huamahihuuroq atuaqaahitaima hivihuhihuuroq iñugiakkivliuni kiiñauranikat kiiñauraqitna atuaq hivihuuruamik tainna utaqqivailuting taavunga aullartitakrakaluaq qiyanaq qanutnagalaanu taqqiraqavat tavrani qiyanaqoqqarti anniartualaqqilit miñihitangat Tabralu taitna. Taitna tabra tamattuma puvaklorni mitna hea kangi taitna hura krauti alawabut. Kanokka nut kakti taklugit nalo hea mitaklugit. Hea mitatuni livlugit tamatkot pira krauti butilyani ahi taima nutakip kaklugit tamatkot awlakti takrakaluat. Kuyanak. Una tamna deputy minister kiulang nera kuyanak. Kanok tamatkot habatakanyaktuni ingmik hitna pinya piarlu pikrarigat. Perlu tamna tawritna habak tamna pianik tunip tawrtabra akpaktuni tamna habak tamatkot hitna hababut trikirarayevut. Tabalu taitna. Tamat kuning ay lichore huktuni kakehaurani taitna. Ilit kugalawar neriga tamna kanutunagilan utakkinyak tilak ramingnik tap tu mga ilitsore ya ilugit. Tabab tamna frame lake min. Taitna lo kanok tamat ko tutkiklu angala rutingit. Kanok tamat ko din na kanok tamat ko din na ilitsarap ka batigit kanok herawati mingnik. Kuyanak. Tabertam na. Tabra tam na habagwik. Tabertam na kanyaktuwa kamedyung na. Tabertamat ko at kanyaktuwa kaya dilitso kanya kakagayat. Kamilari aklugit dilitso kanya piaklugit. Kanok kanakolo tabrani kihenik ingmik tiun kihenik pilyait kait alla niktaukhuli tamatkot inakakamiut nagalunin malakotele akakamiut taitna alla mikhuli alla kun tabralu taitna angaun tauktamna ilyani uktoqaqaluaqalugu developed tainatan million tuntiak kinyawenik atukkaraqagay tapkotin na ilitsoqaniartuat naagalun ilitsoqaniarvikramik ilyaqiniartuat developed na atitilaangitit na ilitsoqaniaraqagayt tabrauna takiroq hibihurok tamna nahabangat. Ataw himi ukiumitay na penik tilait kat. Tabel tay na litsurenik kimarugut kanit nagalan tamat kuninga habab tingnik kanakulo habak tilangit ilitsure himagibut. Inventory nik pirakigayit kamileroktat. Kamilerokulugut tay na ilitsure rakigayit. Kuyanakpak. Kuyanak kakti. Tabelo kating tayo na ilihimarunga ilo kating tayo na hawak parak tot. High level me. Kuyanakpak. Hawak parak tot ilihimagit kailo kating. Tabelo tayo na Inuvialuktun na kanokanyak tilakrangigit na tayo na luwaptik kunit na ilan na tutkok kimarakibut hababut. Ilocano na kuleaktalaitivut. Kuyanakpak. Tabaptakta na tutka kamera nik na ilitsure rakrangitlanik tamat kuningaptok haba kakamiuhit ilihimarunga. Kuyanak. Tabalu tam na tuhala nyariga. Tabali himarunga tait na tunagalani na atua kaktok ugo matkot hawak tibutin na ila ni tabrona hibi hilyakong itkiga unapekutaka. Ilitsok hangmiga. Kanakulugit tamatkotin na kanudun kinyawa ni katok tilangit nagalunin atungi hilangit tamaratay na ilokanyik ilitsoka niya lakugalakit ka. Tuna de wala demin. Kaya nakakakte. Tabarlo na kanud nagalani kot atugat tait nalo atokrat tait tapkot tam na ilitsoka liauhlunga umani ukiu chami atokrap tingnik atokonertilakrapta nipta ilitsoka huktunga nagaluni atukkat matkot ilitsoka liaukitka kayanak kanokolatabatai na igilumik hawagwingmik ilyakiruagut tamatkuadit na itluatun tutkika qablugit kanok hiyak takrabut nagalunin atutikirabut humulika anneaktualakiruatigun tabrahuli tap uma kinyaram pilakrap tingni tap kuat atukkatit na tam na akyang nangit kat pirakput kinyarak kuyanakpak. Tuna de wala demin. Tabrana minhitama kiulabanga kanok kangakilakramnik kangakilakramnik okalautilavinga kuyanak tabarlu tamatkotit na utektichiraaqtut kinyaranik tamatkununa ikayutinginnik kuyanakpak kiullakvit. Sababtak tam na isumati kaptigo GP na kanok hibunniok kemavat. Tabalut taktait na kanutunagalan tabaya annearvitit na tutkikakanakavut heqamitat na kanok angala tamatkuat aulalaaqtaqtuat atukkangitit na annearvingi tamatkuninilu na munakriruanek kanok utoqqanaanik tait na annearvingmuklugit munaqinaqigait. Munaqirakraamata ikaaqqaarlugitamana ikaarneq kuyanaqpak. Taamnalu taba aakasuna nungukpan ilitserap kainiartugut qanut nagalan atoqtilaaptingnik. Tamnalu utoqana annervialuk annervitsiarlu. Taapkook tavero qaqaniarivut aakasngorpaa. Qiinarpak miniitaq taverona 844,000 tamna ingmiktigun havaaligit atoquniakkangat qanoq atoquniartilaakrangiliitsoqilluuk ligitsunga taaptuminga tamna tavera tamna kiullangniaraatin kiiñaranik munaqrihuuruaq 844,000 tavera qaffit kiaqqamma tainna ingmiktigun havaaligit atoquniaraat taverlut tainna qanutnagalaan atoquniartilaakranga taaptuminga kiullakkiga Trinity Williday tavera qiinarpak taapko tavera aperuuttallag River South qiinaq taverona ilitsoqillaqqugiga taverlut tainna qanutnagalaan 332,000 taver taamna quliakkangat tainna aperuuttaqillugukkiga qiinaq taverona nalupqigiga taaptumunga illiqihimammagaan 3,361,000 tun taver taamna uqauchitigun taverlut taamna haneqpak taaqqimaraq kiiñauraq taver ingmiktiguttoqitna tautuktuaqqartut naagilaktamik qanuheqautikramingnik 213 River South qiinaq qanikkunak ulupak oqaqqaaqami minihitam 46% tun inna 46% tun quleellakanga taamna atoqraq qanukinniarmagaan taamna qanorlu tamanna atoquniartilaakranga ilitsoqilluuktunga minitaq anniartualaqalini taverlu taitna taaktauruatinna taaktiuruata taitna maangaataaktit taveraptauq inna takpavanga qairaqartuat oqautigiitkivut agalaan maani taaktivut oqautigiivut tavertaamna tauqaperuutaqaniakkara taitna tunagalaan tamatkuat taaktinikitna qaqitsuuriraqamagaapta naagaluuni maaniittuat ataramik taaktiuruatitna tamatkuataahin anniartualaqiliruatigun tamatkuatitna itna tamanna atuutikrauroqmaunga matkununga itna maaniittuanun taaktinun qiinaq minihitauruaq maani taverluun tiguniaqaluaria qanoqittilaaga taaptumaa apeqiuttam taveryaani takpavunga aullaqtittariivut Alberta mun. Tamnaptauqi na tamauartitaqlugit qaipkartitaqlugit takpavanga ilitseraniaartugut qanuhini kanniarutiqaarmagaita. Ilaani takpavangartittaqivut matkuati na ikayulainyaptigi maani nunaptingni tavraptaartainna nutaqqatinna nutaqavritinna qaffit ingmittiguttaaq nutaqavra nutaqqe nutaqqe ikayullagait nutaqqiniartuat ikayorlugit nutaqqiniartuat maani nunaptingni. Mampoimin. Kuyanak. Tabrauna tautukiga. Tabraptuaq 1.06 million. 82 ittuat. Tabratamatkoit 18 ittuat tainna takpavat. Matkunani hivunniortini ittoq. Tabraluttaortainna. Tabrailaatni yalunaarulaitsut illangitanniartuat. Na tabralutainna ilaatni yalunaik muungilsartut matkuat anneeleqaming. Tamatkuaptauq.
To the small communities. Thank you.
Kuyanak.
Madam Chair, can I confirm with the member that she's looking at page?
Page 192. Tamna tautuktoni kihitchiting up. 192.
Ukot ikayaktit kanok nunengit kaitap kot kanok NTHSSA tap kot manitut havagvikpangmi nunengit chut inawarnun tamna tap kot havangnaqtut tam inawarni tamna ikayuinaqtut tap kot kanok ikayoroklugi tap kot inuit inawarni. Kuyanak. Tap kot malorok migisaartut kanok tap kot aglan ukot havautarikat ngit tap kot nakuroktainna. Ukot human resources niktahuga ikayaktit kanok havangmata ukot kanok ikayun nyaktot kot havaktot inna. Tap kot nulavat inawar nun havaktot inna. Kanok kuyanak. Kanok tainarupta ikayornengit kaitap kot inuit kanok nunnearup tapgot habaktot saina. Una kafan la okal lang nektok Deputy Minister. Kuya who got who got habaktot kanok who got habaktot taina habaktut habaktut taina inawarni habanik tut who got inyait kanok inyait to got time ilihanik kaming tabra kanok haba kanok habaukpit in the road kanok ikayu tunga nursery nursery nagalonin ikayokte tain inyong nik electronic kuinak
Will have, a better choice, can make a better choice, can make a good career choice, but we don't have too many, so that's why I'm asking that if we can have more or some of these positions transferred to the regions.
pinakpatam tapgot inyay tabaw kami kanok pilyavat kuinak got talk nursery rated makot Clito region min in our ni tap tamani kanok ikayu inakirit tapgot ikayone ako kay tapgot Clito region mi tapgot kanok ikayone ako galwakait taina ibakleraloak tap ibakleraloak tu taina tap taina mika ikayok tinik Hagland Beachit I taina got got yarmata tamna kanok habang naktu time ilihanik tonik aglan ilihab far naktok got tap got iliha coming kanok habang nakto taina kanok iliha takto tabang harok kanok aglan inyangit pihungit chuta aulawungit chuta tabang harok kanok ikayornek patigit tapgot got habang naktot kanok pichut taina ilihak pik ukalok tut ilihak ukalok tut taina habang nakamik aglan taina ubagut pichut pekangit chut taina hinik
that can be situated, that can be transferred to
kanok
and our youth can benefit from that.
ikayuhu alwarit kataina kuyanak kuyanak. Administrative and support service tamna time up to the 54,550,000 to atorneli kut 198 health and social programs niktai hugay tuna kanaka una health and social services minihita ko na kiuniak pa humik. Una health and social programs or get kanok. Happy pat Cam Lake min kuyanak miklina koktam na kanok taptima health and family services tam na miklila na hook. Kuyanak tam na kilang na director of finance una. Una Inuvialuktun ikayok magit tap ko child and family services kuyanak. Ikayok mati tap ko nitakhat kanok. Oh God, pinyak mata akakita mata tap ko tap tuming lawyer niktai hugay to God ikayu huraka ukakita mata inuit. Deputy Minister who kakilang naktok. Kuyanak. You got legal fees niktai hugay you got kanok tam na ikayok ti ukakita mata legal fees niktai hugay kanok nagay tap ataw na yung itutap tuminga kuyanak. $44 million dun hama kanudun nudak kadik munarivat. Health and social services. Kuyanak.
Madam Chair, I don't have a breakdown in front of me, but I can say that there are about 1,200 children in the north.
1,200 dun hama munakrihu tap dun tap tuminga ahin at luting $44 million dun kuyanak. 1,200 dun tap got kanok kanok tap got munarimati tap got kanok tapgot foster care nika nutakat munarihu vagit kanudun I am a raovat kuyanak 93% dun tapgot I'm a hugalok tot I'm a hurut tapgot ikayonak tut tap taina tap taminga maning ni kuyanak Kanaka tapgot youth aging out of childcare tapgot daimak 18 years dun pirot kuyanak Deputy Minister una kilang nektok Kanaka tapgot ikayu tapgot Kanaka tapgot munakrit tapgot kaunagi kamnirung kaunagi kamting tapgot kaunig kamirung tapgot nutakat child and services tapgot kanuka akilinyak tutak kuyanak We've got 44 million, $2 million in hamba atogait tapgot munakrit akilyugit $40 million in tamna munakrinya tapgot nitakanik tapgot tapgot youth aging out of care kanok ikayonak tot tapgot kanok pivoting kanok pivotigit kanok kanok pinyak tot kanok tapgot pinyak tot ikayunyak tot kanok ikayulavat kanok tapkunanik tapko aging out of care ntakka tapgot pianik tot kuyanak got kanok tapgot munakrit munarihu katingay tapgot nutakat kanok taptaminga tap kuning board nik nakunayak to kanok tapgot nutakat tautulak luwita kot kanok ikayulab ikayularot tam na tautik tulawit nutakanun tapgot tapkununa children in care taina bihurit Kuyanak.
Thank you very much, Madam Chair. And I was hoping to get to three other things, but I might send some questions to colleagues if they're willing to sneak them in because I think it's going to take most of the time.
It's youth in care that have come to us and have said this, and sorry, youth who have also aged out of care who have come to us and have said this. And you know, I was sent an email recently by a parent that was originated from.
Tamat ko at inuwialuktun na kanok tamat ko di kayo kaniyak kangit nutakat dahil na tawakit na hawak tuat munak rin niya tuat mat ko nga nutakkanikit na ilan ni hapakralagorot dahil na hawak pailuting na tamat ko nga hintay taman na tikilya taklugo kanok munakari riw tikrating nagaluni o kaw tikrating nutakkanon hitna nukat penon nibakanon lo kayanak kanol tam na dito kaya kaloriga kanok tamat ko nukat pet nibakanon na ikayuti kirangat kayanak. Tabra tam na great slave min kayanak tabra na tawag kap ko kanit naglan kinyawer nagpakakti langit tamat ko kanok inawer ni inawer ni ito at kinyawer ni kapakrimata ingakrimata kanok tabra tayo na tunaglanin na aglilyakan at atutik lang at tamat ko at inawer ni ito at tabra luptak tayo na inuwekto at inuwekto na gitna akihuilyakan at tamat ko at tabra tamat ko at na ilyakan nga kadugit mat ko at kanok ikayu tikrat tabalut kafinik na alla kaya kiti tamat ko pira krangit inuit ato krangit tabalu inuit tadi na okaw chitigun dahil na tabra kanok ato kaniyak tila krangit ilitsakarakigat tam na tabra apasaruttakarakigat tamat ko na ingmik kinyawanik munakrihurot tabra ilihimara krakalabot kanok ato kaniyak tila krangit tamat ko great slave me kayanak tabrelo kada na ilihimana huirunga tabrelo kata na ilihimana yaktogut nalo tabrelo tait na kinyara katungi atok ngihak tabrelo tait na mikiro tabrelo tait na tamat ko na tay na tamat ko tay kanyak to kakluidin na nut kakautit nagalunin matkot malakotalet tigun kihenik pekakadi tamat ko nga kinyaranik pilaychut tabalo tay na tunaglan tay na inuit $25,000 tun tay na pihuk tuni tabrang ikayok lang niya aktonin na kayanak Dani tabra tawhimik atawhimik tawduktohimik in ingekhrui kaming agalaktoakkaaqating tabra tamat kuninga taitna ingekhrui raktut. Tabra makpera tamat koatitna tabra tamna kanok taitna kanudinaglani namat kinyawanik pekaktuk dilokata. Itna April me umani ukiumi tabra koatit na ilitrap kanyaktugut kanok atorniartilakringit matkot. Great slave me. Tabra tuharo gut inawalani. Tabra tam na kanut naglani na kinyawatigun koleaktoak tuhakap tigo. Tam na tabra ilokating tait na Kavamarot. Tabra ataw hekanyuk tait na pakruta na yakrulava tait na ataw hekanyuk tabung aulauri huktuak tutkika na ikayorni alugit matko mamiruti kranginik ikayorni alugit. Tabra kot pangmapakhuli tait na tabra ataw chikuni na allat inuitit na pirakramingik agalaktanik pekaroming tapkoa ikayokhatiginiarait tangungitchot. Kyanakpak. Ila ni matkoatit na ingmiktigun hunniglakapekartut. Huni aulatikramingik nagalunin ilokkakoting tavani aulaktorvingik ikayullavatigit kavamaurotukot. Tabertait na pata. Tabertait na ikayullamigu tamatkoatit na ingmiktigun aulakruutautakautot inyungnik. Ikayorni aklugit na mamiritikra pingailiaraming tamatkuninga. Tangangailiarniaraming nagalunin marihematlongnik huniglakaki tabra tamatkoat ikayorni alagait. Ikayutikrakaqtut kavamat. The $10,000 tun tabra tait na aulauri huktuat tait na tinagalan pekaktut. Tautuk naktaktan na ukunani kanyaktuani. Tabra wagutit na kuchikiligo kinyarakatokrak tam na isumatigi put pangmapak.
Madam Chair, this month
$211,000 tam na atokonak kanok fiscal year time na time akpan fiscal year. Family violence nika tapkwat hapeknyaktot kanok tapkwat habang naktot hapeknyandik inyuniaktot kanok ikayorniarugay tapkwat. Got kanok $88,000 tun hama atokonak tam na NGOs nika pihu ikayui hurita tuminga.
Thank you, Madam Chair. The reason I asked that is in the note it does say and shelter families affected by violence. So
Ukota ka tamna
I'd like to ask about is around men and men's supports.
tapkot angutit kanok ikayui mata kanok pinyak pat kanok habak patay tap
Towards men and men's health and wellness given
kanok ikayui niyak tatukot angun tinik tapkot tauk inunik hapernyari kamiru.
just for Indigenous governments and their partners to come up with programming for their communities. So
Kanok tapkot inu kam inarni tapkot habak habautinak to tapkot inu tapkot angutit ikayor nerlugi taina kanok leka ikayu niarurut kuyanak kuyanak
Madam Chair, when I look at the mental wellness and addictions recovery
got tau kanok
recovery fund itself, those are both line items that are around 100,000 and then 180,000.
Tap got 180,000, 100,000 tun hama maning ni katorut.
Problem in our territory.
Kanok
Why we are not seeing any increase in money here and why we have actually seen it.
hok manifani ka pingit patap got kayornek tot kayunyak tot inyungnik.
I think that some of this is communities not seeing how this fits into the programming that they want to offer, and that's one of the reasons that the
Kanok ikayok
asked for block funding.
got tangung chot kavamatit kanok pihukalo pinyaru gai tap got manit.
Residual money. So the point of the block funding is to make sure that all the money goes out the door. If all of that money disappears very quickly, then
Money tap got kanok
justify expanding these funds.
tap got manit atong mata kanok kolero gai taina kanok leka kuyanak. Kanok tamna Health and Social Services Authorities funding kanok 278 million tun manikaligin yakot kanutun tapkot ikayok patit kanutun Health and Social Services suna
Madam Chair.
kuyanak
There is no Yellowknife Health Authority. Yellowknife is part of the NWT Health
ta mani pingichut Yellowknife 236 million. Hay River, TCSA. Got money that tuligin yarait kanorleka tap got koleran kolerait tap got kanutun atogonet liginya mata. Tap to makpeak pangmi tautulagay tap got kanok manit atogonak atuligin yakot tap got maning niktayna. Tabachamin.
Maybe I should go to page 198 then, regarding, Madam Chair, community clinics and health centers.
Community clinic health center. Kanutun tapkunanik maningnik atoruva tai aichok aichonak Fort Smith mun kanutun.
develop their own budget and report it in their annual report. So we don't have line items in here that are specific to a region such as Fort Smith. Thank you.
Tabacha.
That is kind of not very clear. For clarity, I would like to know how much money is allocated to the
Kanutun maningnik Pivot Tapgot Health Center in Fort Smith.
We don't have that information in this budget. It's
Tam
for the department, not a budget for the authority.
The thing that I'm trying to get at is, with the NWT board now,
NWT board Tapgot Kanok Kaunagi Hugay Tapgot Fort Smith me.
2 in Yellowknife, I think it is, and 1 in Hay River. Maybe
Kanuka atong mata maningnik.
advisory, and they all belong to this NWT board. And since that happened,
Got NWT board nik tay hugay to got Kanuka kaunagi nak inyong inart humila ka kaya nak.
Minister, could please how even an advisory board could ask for different statements, financial statements on a monthly basis at their regular meetings if they're not entitled to know what's going on in those health centers. Thank you, Madam Chair.
Minitak Malo pingahonik taber health and social services tap 3 pingahonika Clicho community service Hay River community service tap got pingahut havak to tap got
And so I believe that the Regional Wellness Council,
got
which exists in each of the regions, would have information specific to the region that they can
Regional Wellness Council Nick Dahugay to got havak dot kanok all of Louis tap got kanok inaward pingahut.
that is transferred to each of the health authorities that pays
Got kanok maning nik atong mata kanok tap ko kolea na kolea apekruinak to tap got
because it is not part of the department's function. It's up to the Health and Social Services Authority.
Health and Social Services Authority tap got apekruinak to kuyanak.
Yes, Madam Chair, it is a concern to the advisory council
Kanok got
that they don't get financial
Fort Smith me kanok
reports on exactly where the health center stands. I mean, if I sat on any board or any kind, even if it was an advisory or whatever, I would
kanok tap got habagubat kanok kayo mata inyong nik.
and I think that should be, I really appreciate if the department would look and make sure that the people that are sitting around the table have access to this kind of information. They're not gonna be sharing it with
Got kanok
because most of their
abekruinak nagalunin kiunak kanok
issues that they're discussing.
pinyakpat kanok ikayuinakpat
Thank you, Madam Chair.
kuyanak.
Yeah, thank you, Madam Chair. Madam Chair, the different entities of the
ukat kanok habang mata kanok health authorities nik tayo guys kanok maning nik ato kaming kanok kanok laka kanok kolero rit kanok kadutun ato kaming kaya
The other thing I want to talk about is, you know, a lot of the services seem to.
got habang mata kanok
I'm just wondering if the specialists visit.
kanok pinyak pato got hasba
It's much easier for.
Stanton mi hannerving mi tap got pularo but inaran kanole humile ka Fort Smith mi tap got kanok got specialist nik tai hu du got kanok
Stanton here in Yellowknife, and I just wanted to see how.
shock yak luit shock perner luit ni kanok leka aglan kihut kanok havaguvat kaya
It does present some hardship for elders to travel to Yellowknife.
ukat inya kanok
Specialist care,
utok kanat ukat kanok
exam rooms, special
habernya tok kam iglaw kami
administration to make the appointments and remind people of them and so on. And so Stanton is set up to do that. So it's not just a matter of parachuting one person in. It really is a team effort. And so that's the reason that it's offered at Stanton. That's
kanok tama ni Stanton mi tok tam na kanok ikayi kaming utok kananik kaya nak kanok tap ko detox center miktok ikayon actually tap ko ingming yun tut kikarnek tot kanok got detox center nig dahu gay tap got igluret kanok tut kikak inuit tai piani kaming tut kikarnek luting ingming yun tam na huichu tai na aftercare nig dahu gay kanok ikayonak lugi tap got inuit tai mak tot ingming yun isok kinyak tot tai mangit kalok tot aglan
Done with that because it's a major problem within our communities, and it's a major problem for all of us here in this house. Thank you, Madam Chair.
Thank you. Minister?
Yeah, thank you. I know the member has heard what I have to say about this, so this time I'm going to ask her if she'll listen to the Deputy Minister talk about what's offered for detox and where. Thank you.
Thank you. Deputy Minister?
Thank you, Madam Chair. Thank you, member, for the question. So currently we do have
got natira ingming yun tot kikarnek mata igluit Fort Smith mi aglan mani Stanton Hospital pekak tok kanok COVID mi pachi naktok huichut ikayun ikayonek pe ikayub pearnek dot inyong nigtap kot nachirot ingmin nakokinyak dot kinak ukot child and family services tuna nitakanika munakrit kanok tap kot habang nakto daw chikun tap kot kanok nitakat I've gone there coming kanok habang nakpaktam.
I think that
Tap ko tabra na ilitsura niya alawid ilitsura irakrakalabot. Tamat ko no takat pirt ay mangin yan pirt lugit tay mahin utaktin kanok utaktin niya nakpat tamat ko no takat matkot ikayuin niya tot inyong nik muna na tigum mikangit utak kanoluit utak tinak patam na pero takalaki tam na tawk una tabrap tawk pangmapak tay na ikikput nutakakini itkukibut nutakaurat tay na tabrap tawk tay na inawraming yun inawringin yun awlak titakong ayakibut pangmapak 8% yun tamani kanok tamat kot nutakhatit na nutakhat pirtitayat ay mabingin yin law tiblugit na piakluk taktot piak kolarot kanok titaktot nutakawratit na tamat ko nang ay mabingin yin awlak titakluit tamat ko na ilitsuralugut pangmapak kanok awlaw tirakakungaya kilugit inawraming yun inyugokabingin yun awlaw tirakakungaya kilugit tabran inyugokabingan yun tabran na ikayok lakanyak to tamanit patatay na tabra IRC ptak tay na tabra tamatam na taman na kakuaglan tam na ilitsarap kakanak patigut tap pinakapaglun kaya nak tabra tamat kot nutak na munak rirot yaka pelak tut inawram ni ikayok takakugalwakit ka abang alamin inilanin ki alanin tayo ni ikayok takakugalwakit ka tabra ni ulumilyo tuturak 2 milyo tamat ko tabra na ikayok takakugalwakit ka na yakapel lang matano munak rot na anektonik. Ilang ito, so inyong ito na inming yun piyak takto na tayo maktakto tabra man puwaklo ko ni na huy nyalipaka. Tabra kayok takap kopel laktud inyuit inawram ni habaw takay kamniki habaw takay kapti matkot habaw takay katka inyuit utok kanat matkolo na inyalat tabra tanga ni nagalo ni tabra kanok marehemal sung ni crack cocaine mig pirakigat taman na marehemal sung Inuga kiinaktok tuturaktuumi humilakakiini anarani. Tabra atauchikuni na tamatkoati na. Tabralo IRC kutin na ta inipet na katimaringin nik IRC nik pirakigay tabratapkot na ikayo tilu ta na tutkikarnearneari uttamatkot. Tabralo tayo na utiktitakagayat nagalo matkot natakat. Kuyanakpak tabra. Tabratapkot utiktitkugalawaravut. Tamatkot tayo na. Tabralo tayo na hapakaraktot matkot tayo na. Matkuninga ikayo tikrangin nik pakitsit kugalawarafi. Tabralo kanakaluit tabratay na. Tabra Inuvialuktun Regional Corporation tapko tabra ingmiktigun na katimaringit. Kuyanakpak. Kuyanakpak. IRC? IRC. Tabra ilingitak tayo na. Ikayok takaktut. Tabra luktak tayo na ataramik tayo na ilitsarap kay raktut kano kangalari timingik. Kafinit kaya kafinit kaya ko kiuni tam na uktuak kamabarsong. Hibi hulsawala kalawaktok kaglan hibi hok pangitsok. Tabalut waktamat kodin na okawritigun okawrinikun na inuit okawtirakigait tamat kuninga tabra IRC din na ingmiktiguntak tamat kod uktak kamagaitin na ingmiktin matkod ingmiknyun tokot ile nutakat nagalunin inyala tabra tamatkodit na kautin na akaluit tutkikanya ako tingkiya taramik tabra tamatkod IRC pinyakamagait pang mapak. Kuyanak. Ninakput. Kuyanakpak minihitak. Kabamat. Kabamat doon akanyak padrong. Ilitso kanya ako tingtay na ikayutik ranik. Tabertay na. Tamat kuninga na. Mani nunapting ni Beaufort Delta me. Tamat ko din na ikayutik ranik. Isumarakibat. Tabertay na. Ilokan at tawhek inaurak. Tayo na mata tayo na. Ikayutik ranik tayo na. Pimarutuko at tawk. Tabelo kating. Jordan tutu kay kugalawa ka mga ukautit kabluitaw tamat ko nutakat na galo ni iliharaktaktot mat ko nutakaurat. Tabalo tayo na itsumad kanokin magantaman na ilihimamaw na kapelek to ni isumak to ni tamat ko hapekrelek to ni kanok taman na kanok tamat ko na akpalaning at tap to mailihimaga Jordan tutum. Tabertam na kahit kurakagayat tao nunga o kautilak to kaluwit mat ko nutakat tawak tayo na pang mapagtay nangit kalawak to dagalan tainna isummatakhaarna huivlugittaaq tainna quting tamat kununga oqauriartoquiraqigaat qiyanaq ninakpat tabrauna apaqhuarlu tabraukuat tuhat qullagikput matkuati na takpavunga aulaqtitaqtat tabralu tamatkuati na haperniaquvlugu tamanna aullarniartuat takpavunga uktuariaruktuati na imiillaerniarniq malahimallungaerniarniq tamatkuat tabra aullaruguting tauqilaani haperraartut aulla qanoq aullarniartilaaksramingnik tabra tamatkuat ikayortaugrapiaq tut tamaani takpavunga aullaruktuat qiyanarpak tabra tapko tabra tamatkuat qanundalaan in tap tuminga aullaqa itna igilaugutikranganik naagaluunniit pulaktautikranginik qanutnagalaani na nalupqihuktungapangmapak qanoqulu tamatkuat ihimarunga tainna ikayuiniartoq taamna taunungaartarmi tabralu tainna tunagalaan atauhitsiamik kihianik takpavunga ikayortikramingnik ivaqleqaming aullaaqartuat atauhitualungisaami inugiakkillugi taapkuat utiqtarvisrangit qiyanarpak Riverside qiyanaq taamna uqarillanniariga qanutun taapkuatinna qanutnagalaaniñugiaktuatinna quliaqaniaqaluaqapki quliangaittikkain iñugiakpailluting tabra taamna uqauheq itna mamitinniarnit matkuat nutaqqat angiroq tainna tabra ikayorniaqaluarluit tainna tunagalaan tabra tamatkuat iñugiakkaluartut ikayorvikrangit ikayuiniartuat tamatkuninga isumaartuanik naagaluunniin qanoq isumaarpailluting ingmingnun toquttartuat tabraukuat tainna tamaani taavunga aullartit qaarnagit tabra tainna ikayuihurutakpavunga aullartittuni tabra tainna tamatkuninga detoxnik pilarigaitna taimaalaangaartuat qappini uvluni tabra niittuartillaaraqigait itna ikayorlugit nalapqiuktuattaaqtumun aullarniartilaaksramik kia ikayorniartilaaksranginik qanutnagalaan maani itna takpavani iñugiakpat taitna hiniviqarpat taitna tukkuqarpat takpavani miñitaq qiyanaq tabra qappiniquna kiullangniaria tabra utaqqiniquna 23 tun uvluni tainna tunagalaan utaqqinartut tabrunga tukkuviksraminnik tabralui na iñugiak ingilaqaan tabra tainna tunagalaat tabra atauhimi tatqaqiutimi inniaquvit tabra tauqtainna tunagalaan inna utaqqiguvit tainna tunagalaan unga ay na heavy huhirok heavy huhilyak na tam na tikit niya aklugo ya ni tam na heavy huhirotun ublungit piraktut 52 luni tamat ko tara here me tay na uktokakto tamat ko niya tay malak niya kanin tanga ko nagalunin hul tabalu tamat ko niya marihimatlong nik tabalu tay na pilyota ko pilyota ko maher nik tam na pichok tabrani tabalu tay na tabrunga maminyak to amuk kalwa koming anik pata munakrikranga ni Inuvialuktun. Tabalu tay na tamat kot kemilreo na yakebot anik pata tabranga. Tabalu tap kopi ko manengit kibot ili hemana na yakebot na kemilreo lugit kanokitilang itin na munakanya lugit tamat kot na kuyanakpak. Remember South? Kuyanak. Okakte. Tabrap tawak tayo na talan. Good luck. Good luck, Mick. Mga okakto nga ako. Pilyaw ta ka. Nakto nga galan tayo na tabrap tawak tayo na Inuit. Tabrung aktita ka gait mamirbing mon igilok kakoting. Maminiyarbing mon igilok kakoting. Tabrap tawak tayo na tinagalan. Tayo na tabrung isa kalaktut. Ani kami nga ito tamat ko nga. Isagutit kigaktut. Ikayok ti kaming ibak pakitsuk tukragalot. Tabralu tayo na tinagalanin na ukakatigap kita mani pisikata akto atin nalunin tayo na tabrap tayo na nalakto ayan nga nagalunin na kan nguhulay chudiwam nun ukakaming. Tabralu na ilan ni
I know that even if we had one, like the minister said, there'd only be a certain number of beds. We're trying to accommodate everybody, and it won't happen. So we have to do something different, and that's in providing the beds down south. I've got no problem with that. I know some of the people I talk to.
Inuvialuktun takpavani tukkuvi chut. Tamat ko na ni mami niyarving niya ila ni inay chaktut tamat ko tutrik na mami niyarving niya ilang iti utakhenyaktut manip tawak ubagut mani territories ni togut tabertay na hinik aulakit isagutit kikup isagutin agutigup tamat ko ni nga taber na kakayaktok tabraw na unap tawak aula imak para ka dugo kan tabrunga kalawa kan eh tabrunga takpabunga hula kalawa kan eh kaya makpara ka ako ni takpabunga kirok tabrap tawak tayo na hit utek tak tawak tit tamat ko ni nga tamat ko to kakad lang nayakit ka tabralo tayo na tawak tayo na Tabrunga detox nik pidakigit mamin niya kaluaktin nagit na tamat kuninga in anniarviktun ittuak tillagakigait. Kilamik takpavunga ulaktin niakigait matkot. Hin utakhep kakpangaakidugit. Tabralutai na munakrini. Tabraptawili marugut tai na tamatkodin na utek taktot nagalunin tai na tai malak taktot tai na tot inyugek tut mani. Tabralutai na ataramik tai na tabra 2018. Tabratai na. Kuya hukpauraktot inyugek tot tautuk kimagitka. Tai na.
In misery. I think that there are others, of course, who would prefer to stay here.
Tai na inyugek tot na mani to ako ting pihukaloaktut. Agalanin yang itak tamatkotin na munakrinyak tot nagaluni kayuinyak tot inyugek tot mani yalunaip mit taududla kamitigit. Tapkop tawrit khayungit so takpavani kuchin takpavani na mani nunapting ni yalunaip mi inakaktut tamat kuninga inyung niktai nikayuinyak tonik mam imingayyak tot nagaluni tangak tot ataramik marihimatluk tot tot ataramik tamat kunanga maminyak tot inyugek tot. Tapko tabre ikayokra peakigibut. Tabrelu uktoka kralo rabut taitna. Tabre uktoka tukragaloaktut inarani ittuat. Ikayokaneakluit tabre ikayokaneakluit tamatkuatit na. Mani nunapting ni ittuat. Tabre tamatkuatit na. Ukiapak tait na. Tabre tamatkuat uktokaneli kibut ukiapak. Kuyanak. Kuyanak.
About a constituent member who went south from for resolution to go visit family.
Ukot ay mabimni inaram ni kanoka ukot tam naptaw ka inyo kay mabimni kanoka massive heart attack miktay hugay ukot kanoka umating atay maklaktuak aglan nakurok nakuhilinya ko aglan kanoka tak tilikinak toktak kanok nakpat ukot kanoka ikayuinya kamta aglan tam na malerote maling naktuktauk, malirutilit maling naktutauk, tapka haperanyaktut. Kanok tamna malirutilit kanok haperanyaktuk kan maling nak maling naktak aglan haperanyaktuk ni maling nakaptiu. Fourth resolution mitam tapkat kanok
That's one. The other one is, the healthcare card system here in the Northwest Territories. I think it's getting to the point now where, level 1 healthcare card, to me, the way I see it is that, in my mind, is that we do have the military that is treated probably the top of the list in terms of healthcare card, health services. And then you got GNWT employees who pay into the system to get these extra benefits. And then you got my constituents that just have the basic healthcare card that is left out, and to me it's a little disturbing. But at the same time, I just want to maybe let the minister know that if there's a way, I'm not sure how far are we in this medical travel review, and maybe you could just update me on where things are at with that. Merci.
Thank you. Minister?
Yeah, thank you, Madam Chair. I just note that the supplementary health benefits of the budget is the place where the medical travel budget is located. Medical travel is for people who are referred south for service. That is the purpose of it. So if you're unable to obtain health care in the Northwest Territories, medical travel will get you to the south to get that care. The healthcare cards are, there is one kind of card for every NWT resident. I'm not sure what the member is referring to in saying that there are different cards for people in different levels of government. I'm not sure what that's about. So if he can clarify that, maybe I can try answering it. Thank you.
Thank you. Member for Trinidad-Willowday.
Madam Chair, and thank you, Minister, for your response. Those are the comments that I hear from my constituents in the community where there are different types of care when you have these healthcare cards. So what I hear is that the military is treated with that same healthcare card like everybody else, but they're treated a little bit different because of that, maybe because they're with the military here in Canada. And then you got the other one that is the GWT employees that they pay into a better healthcare system. And then you got the basic healthcare for everybody in the community. So what I mean by that, Mr. Minister, is that Madam Minister, is that the GNWT gets a full meal coverage. They get the hotel coverage, the car rental coverage, etc. But then we got my members that are that don't pay into this GNWT plan. Then they get the set basic minimal coverage on health on the say for example food. I think they get I don't know what they said they get a day. I don't know, $20 a day or whatever it may be. But again, it's just a different type of service. And so maybe if the minister could help maybe clarify that so I understand that. Thank you.
Thank you. Minister?
Yeah, thank you, Madam Chair. Madam Chair, I think the member is talking about employer benefits. So the Government of Canada would have employer benefits for its staff. The GNWT has employer benefits for its staff. NIHB provides benefits to Indigenous people who are First Nations and Inuit. Métis health benefits are specifically for Métis beneficiaries. And then the rest of the population are just covered, either covered by the basic hospital and physician services, which are provided free of charge to everyone, or in some cases, they don't have benefits at all. We know that there are at least 2,300 people in the Northwest Territories who don't have any form of employer benefit, and so they have no drug coverage, no vision, no dental, no medical appliances, nothing. So these employer benefits do vary according to who is providing them, and some are certainly more, what could you say, more generous than others. And so if you compare GNWT benefits to NIHB benefits, certainly it would be better if you had GNWT benefits. Benefits is to work for the GNWT. Thank you.
Thank you. Member for Trinidad-Willowday.
Thank you. Thank you.
Trinidad-Willowday.
Don't question to this.
33 communities in Northwest Territories, and we don't have a lot of government jobs in our community, so it makes it really tough for constituent members in our communities that really need the care and services and of the healthcare card that we have. But I just wanted to maybe let the minister know that if there's a way we could take a look at the medical travel policy and maybe have a thorough review of this policy, so that I know it's a tough job that you have. I know that you got to follow these policies, but sometimes in the special circumstances, I mean, you probably use your discretion and that kind of thing. But at the end, we hear all these stories up and down the valley, and it's really frustrating, But you have a tough job, But at the same time, if there's a way we could probably maybe work together and trying to improve this policy, and 9 times out of 10 too, it's all about funding, and how is it funded? We probably don't even get enough money from Ottawa on this.
Una kanok medical travel aula mata anya kaming kanok pinyapat tap got kamil aloarat kanok tap kunenik ikayu nyak mata kanok ikayo nyak mata kanok niit aulang mata anya kaming got ikayok pagugay tap got cancer anya kaming tam na ikayok paragugay tap got kanok nan habag kami kanok leka kanok pinyak got kanok government kanok ikayo nek ikayo na tap kununa kanok anya kami kanok $17 million in hama uni adorod kanok ikayo nek luitap got anya got aulang mata tap got nuna mudmina okauti huit tap got kanok pinyak mata pimata kanok about tay madrung tam na koyanak frame lake ko na koyanak humit pita kanok tamna adult FASD services tamna in Inuvialuktun tapkot annearmata FASD mik. Kaya Ugot tama hakutari huga taina FASD mik havakami tamna kanok tapkot kanok kayu huru tapkunenik anneartod FASD mik bihurut tamna kanok ikayu hurut kanok havalun havang nalinya koktamna havakti ikayu hurut taimna FASD mik nutakat anneartod qiyanak.
They have a disability, so are we prepared to handle more demand for that service over the next while? Thanks, Madam Chair.
Thank you, Minister.
Yeah, thank you. I'll go back to the Deputy Minister, please.
Thank you, Deputy Minister.
I can't, thank you, Madam Chair. I can't say whether we are in a position to have more demand in relation to the current services that are being provided. It is something that we are aware of. One of the things that I think that is particularly difficult when it comes to FASD is the diagnosis in and of itself, of course, and sometimes backtracking. I think the key piece to this is to ensure that we continue to provide supports and services to the people where they're at and what their needs are.
Got kanok apekrui kavita una uminga kanok habang mata kanok leka ikayorne akluitap got kuyanak frame lake kuyanak tap got awlang mata kanok akiliyako batigit kanok leka ikayoro batigit hospital mong mata annearming mong mata taina akiliyako it putay taina akiliyo hurugut kain taina panak una ikayoro batigit tap got ichak tawup miktot naga taina tap got ikayoro like ikayoro kuyanak frame lake. Tap got kanok habang mata kanok pinyaru patigit kanok habaktot kuyanak.
Yeah, thank you. It's important to us to offer equitable service
kanok ikayunya hurut kanok leka tawhimi kama habakti kaktut kanok tap got awlang mata.
Territory. So the way we're trying to achieve equitability is to have people travel in to.
Kuyanak. Taiku. atauhimita tam kanok annearon pakitsikamin annearotinmi patakit pakitsikamin.
Kuyanak. Minirak. Tabar tait na ikayokte siramingnik ibaklektot. Tabar tawak tait na munakri matkot mami tichinyaktot apakiroktal lagait okarihurot kinako tichinyakaming. Kuyanak. Tamatkop tabra anne aktual kredilangita anne tamat kuninga anne la kaming na ilangit na okauti wakakan nagit na tamatkot tutrikalaitkait. Ilan ni tamat kuninga Inuit okaurihurut anne biuraktonik nagalunin matkuninga mamilaktonik annearutsertonik tamatkot okautihugait isuatuni na inyuhinginyik okautihugli kuyanakpak tabalutai na kuyanakpak Minyitak. Kuyanakpak tap timinga okautillakam nga. $198. $2023-24 me $368,795,000. Tam na nagwanyak pa yung kuyanakpak. Tapkap ka 203 la tamatkot hibihuro kami has pilimito akurot matkot na utokanat. Tabraw na pasurta ka ako pasurta ka falang nariga. Minitak. Tama tabar 8.5 million dun tamat ko kinyawar ni katakuneli chutay na tamat ko nga
Thank you very much, Madam Chair.
Kaya na. Tamat ko tam na tabar ni ukaktiluta. Tabar na minihitam una uka. Tabat ko tabar ito ilitsarap kalako tunga tamat atay na Stanton mi itot kihinig.
4.23 is for long-term care, 3.9 million is for extended care.
Tabarlo tamat ko 3.5 million.
Legacy are already funded, so there is no additional funding for them in this budget.
Thank you. Member for Cam Lake.
Thank you very much, Madam Chair. And can the Minister?
Kuyanak, ukakti. Tamna Stanton legasimik taniktun pirakanera tabar tamna kaku ang makanek tilakrang tilianga umlokangit kalakting upinakami aglan tuharong upinakako. Tabar tamna upinakaktikit kakinyanig tiligitsak tabar tamna dahil na kilamikay tabar nga nut kinakot Inuit $5 million kagla tamna apasuta kadlawki. Tabar na apasuta una agip ka lang ni akipin. on munga tabar taman na pilatin dego tabar tamna atokone kangat tait na tunagalan aglan tamna tak $5 million atok pakiat tabrunga nupti tao mehit tamat kuat utok kanat kalame khali chaka matame malo ko kiuk khoyanak tabralo tait na taman na tabre ismalo tamna itkagili tikput tap ko tabre kano haraw tiksangat nik tamna tabralo tait na tamat ko atin na upinakami nagalunin upinakami ki nud pata matkot isumagi niya kebut kanok tamna ulumikingay tabre tait na kota tait na tunagalan kanot nagalan tamna isagutilgin marung isagutilatalgin marung tamna kuyanak tabraw na ilokating tamna kutsik toanin kamamaurot tait na tunagalan tamna atokigaloakat aglan matkuap taok pingayoanin matkot ikayui hurot ikayui nyelgi chutap tuminga kanut nagala tabar tamna pingayurot tait na ikayoneli patigitap tuminga
Minister of Health and Social Services.
Yeah, thank you, Madam Chair. Madam Chair, the Department of Infrastructure is
ukot habak pang nika munarali tay na sa kanya right
We're the end user, so we get the keys, and at that point, we sincerely hope.
tapkot habak pang nika pihurot tabla habang niya right tapkot kuyanak
I'm wondering if the minister can also identify
kanok
the cost per bed that Stanton Legacy uses for long-term care clients and the
kanok tapkot annerming mi munakri huvat kanok tapkot inyaktot hunika tapkot kanok ikayornerpat tapkunanik kanok tapkot kanok ikayor makit kanok pihuvat Health and Social Services kiulang naktok pifarneriga anu kiuneriga kuyanak yunakput tapkot aimavingni ik munakrihurot kanok pinyakpat inarni kanok akihuba kanok maningni katuruvat kuyanak
Thank you, Madam Chair. Thank you for the question. The details of the NTHSSA budget
kanok tamna budget niktay hugay kanutin maningni katuktot kanok atorunertot kanok tayo na hinik maningni kanok atorunat Kaunagilaikiga una COO tap got Narani Pechronak to Kanok tap got Habak Klianak. Tap got a Kautinerit tap got Kautinerit tap got Munarehurot Inyanik Kanok Kanok Maning Nikatovat Kanohin Kapfinika Maning Nikatovat Kanok $21 million in Hamma Atorut. Tap got home care I'm a mingni 46 million tap got Atoroi tap got Inuit Ikayorot Kanok tap kunanik home care I'm a vingni Ikayuerot time Kanutun.
For Delta, the Satu, the Decho, Yellowknife, South Slave. So how it's allocated among those entities is part of the NTHSSA budget. Thank you.
Thank you. Member for Nanac.
$46 million in Hama Atorunak but tap got home care mika I'm a vim in night I've a mingani Kanoka Ikayurubet Taina $46 million in Atorunak but Kanok. Got a picture who would Kanoka Hakutare Hooverung tap got a picture Kanoka Hunak Patit. Got Kanoka Ikayu Huro tap got home care Mikta Hurate Kanoka Ikayu Mata Kanoka. Ikayuin matatap got Havak family care program Niktay Hugait Kanoka Ikayuin mata inyong nik tap got pilay chat ingming nik. Tam now. Kanoka tap got time na aging in population tap got Inuit angayokaktot akwaktot Kanoka ikayonak to tap got kuyanak. Inyait Kanoka Ikayo Nebel Putai type got Ngayokata Nagalunin Aquaktat type got Kanoka Ikayo Nebel Laktot. Got Ikayonak Belkalok to got Inyarok Kanok. Got Ikakarlu Nunak Putap got Ikayonak Kirita Hulai Chat got Kanok. Ukat ikayuqnak kapiallakkalaqtutukat inyauttat qiyanak.
I didn't hear any questions, but did the minister have any comments?
No, thank you for that. This is a big priority for me. I toured the members' riding in the summer of 2022 and met elders in Sax Harbor in particular who were trying to hang on.
Tabab tamat ko utok kanatin na ing miktigunit muna kanya to ting mingyun tabalutay na ataramik tay na nakarot ing ming inyune ako timingnik kanok na rewak to tamat kuninga tabab tay na tunagalan kapinya ungahik paurak to ami inyune akimarut tamat kot tabertap tuma akipiaka umutiga tap ko tabra ukapa upat kama lakli chitama tap tu kigatuk How to do a kigati kanizoguk?
Well, we have to, but we have to listen first.
Huh?
We have to listen first.
Okay, okay. Hello, what's his name, huh? Jackie.
Oh, yeah.
committee, we are continuing on with health and social services, long-term and continuing care, and I am going to turn it over to the member for Frame Lake.
Thank you, Madam Chair. A few questions here. I'm just wondering what's happening with the paid family caregiver pilot project, and is it still going? Is it going to be expanded? Thank you, Madam Chair.
Thank you. Minister of Health and Social Services.
Yeah, thank you, Madam Chair. Madam Chair, the program is still going. It was evaluated last year and found to be useful. We have funding for 1 additional year, and then we're going to be faced with a decision about putting it into the business plan for ongoing funding and whether we can afford to scale it up. Thank you.
Thank you. Member for Frame Lake.
Thanks, Madam Chair. So is that, where do I find this in the money, in the money in the budget? I know on the grants and contributions, there's a respite fund. Is that different than the paid caregiver program? Thanks, Madam Chair.
Thank you. Minister?
This is Disabilities Council, so it's not the paid care.
Money, isn't it?
Yeah.
We're looking for that, Madam Chair. I don't think that that's what you're looking at on page 204. This is a federal contribution agreement that provides for this through one of the existing bilaterals. So I feel like it would be near the front with revenue summary, maybe. Which of these funds does it come out of? Home and Community Care Mental Health.
Yes.
While they're looking for that, member for Frame Lake, did you have any other questions?
Thanks, Madam Chair. Yeah, look, where the money comes from, if I understand it's from the feds, it's for another year. I think we're going to have to look at making this a permanent program. But I wanted to ask about on the page 203, home care and support services. You know, back in 21-22, it was almost $24 million. Then it went down. It's going back up a little bit. What's happening with this line item? Thanks, Madam Chair.
Thank you. Minister?
Yeah, thank you. I'll answer the first question first. So if the member looks on page 182, there is a fund here called Home and Community Care and Mental Health and Addiction Services Bilateral Funding Agreement. And that is the fund that we're using to address a couple of priority areas. One is mental health programming and crisis support. And the other is the paid family caregiver program and the implementation of this international resident assessment tool known as InterRI. So that's where the money is coming from that. That fund expires at the end of March, and it is being renegotiated. So that will certainly have an impact on whether it's continued. The next question. There was extra money in 2021-22, which was part of the Safe Long-Term Care Agreement from the federal government that assisted with COVID expenses, and which has since lapsed.
Thank you. Member for Frame Lake.
Okay, thanks. So there was a big review of home care services, and I think there were some, policy level changes that were made. But are we actually increasing any money in the budget to help better support home care services. Thanks, Madam Chair.
Thank you. Minister?
Yeah, thank you for that detail. I'll ask the Deputy Minister, please.
Deputy Minister?
So, thank you, Madam Chair. So currently, the funding that we are using to support some of the recommendations that came out of the Home and Community Care Review, which I believe is what the member's speaking to, is we are using both internal funding that has come through the GNWT as well as our third-party funding through our federal funding that we receive through the Home and Community Care Agreement as well. So, for example, some of the areas that we have invested is we have invested in 3 regional home and community care nurses to provide clinical oversight to the home and community care program. We've also in the last year also implemented 2 territorial wound care nurses to help provide support to complex wound care, particularly for those clients that have that need extended areas of wound care that require some specialty services. And we are also looking to invest resources to enhance hours for home and community care beyond the existing hours that we currently have, which would normally be Monday to Friday. And that is in 2 particular areas, in Betchico and in Hay River. And so those are some of the examples of where we are expanding the services from that stemmed from the Home and Community Care Review.
Thank you. Member for Frame Lake?
Yeah, okay, no, thanks for that detail. I guess my last question is, what's the status of the senior strategy? And I'm sorry if it fits in somewhere else, just this seems like a logical place to ask. Thanks, Madam Chair.
Thank you, Minister of Health and Social Services.
Yeah, thank you, Madam Chair. Madam Chair, I intend to table it during the next session. That is the May-June session. Thank you.
Thank you. Member for Hay River South.
Thank you, Madam Chair. Just a couple questions on the paid caregiver. I think most of them have been answered, but a constituent there in Hay River had asked me if there was any appetite, I guess, from this government to increase the remuneration amount or the number of hours that that they can charge for. Thank you.
Thank you. Minister?
Yeah, thank you. We haven't considered doing that because it would mean that fewer people would qualify for the program or have fewer hours. So we set a number of clients that we would focus on in each community, and that's what informed the funding pot for this year and the carryover for next year.
Thank you. Member for Hay River South.
Thank you, Madam Chair. And the 2 years, I guess it's been in operation 2 years, and I think you said you extended it for another year. What was the review criteria that was used, I guess, for the extension? Thank you.
Thank you. Minister?
Yeah, thank you, Madam Chair. I'll ask the Deputy Minister to talk about how that was developed. Thank you.
Deputy Minister?
Thank you, Madam Chair. So there was an evaluation done that include conversations and interviews with the clients and their families, as well as the service providers. The other thing that I would just add is one of the other reasons we're extending the program in the coming year in its current existence, and also using some of the other areas to inform this program, such as the supported living review. And so over this next year, we hope to be able to use the supported living review as well as the evaluation from the paid family caregiver to determine what our next steps are in relation to that program.
Thank you. Member for Hay River South.
Thank you, Madam Chair. And with that program, do you see a need, I guess, for home care support as well, to sort of back up that caregiver position? Thank you.
Thank you. Minister of Health and Social Services.
Yeah, thank you. Yes, there would be a partnership required of the nursing staff in home care, along with the paid family caregiver. They would be offering different kinds of services to the client. Some of them are more medically sophisticated, if I can say, administration of medication, changing dressings, and so on, whereas the paid family caregiver would be doing basic necessities of life.
Thank you. Member for Hay River South.
Thank you, Madam Chair. I just want to talk about supported living. In Hay River, we have a facility there, and it seems to, work fairly well. And I think most of the people that are living there are pleased with it. Has an assessment, or is it? I guess has an assessment done in Hay River as to whether that facility needs expansion? Thank you.
Thank you. Minister of Health and Social Services.
Yeah, thank you. I don't think there has been that kind of an assessment of the facility in Hay River. Generally speaking, we have moved away from facility-based care for people who need supported living, and instead have them in family groups or near family groups rather than in group homes. So I don't think anything will happen with that facility in Hay River. I mean, there are no plans to change it, but I don't see either that we would expand it.
Member for Hay River South.
That's all. Thank you.
All right. So, Health and Social Services, Long-Term Care and Continuing Care Services. Member for Great Slave.
Thank you, Madam Chair. I just wanted to get a little bit more information as well around like the respite fund. Noting that it hasn't gone up by very much, I'm just curious, as part of the supported living review, are we looking at that amount of money as well? And I do note that it goes to organizations rather than from the department directly to individuals providing respite. But the reason I ask is because I'm aware of a few situations where people are living with our caretakers for children with disabilities and they're not accessing respite. And I'm just wondering, do we have any numbers on whether or not that number is actually adequate, or if it's really just a matter that people aren't aware that they can qualify for it? Thank you, Madam Chair.
Thank you. Minister of Health and Social Services.
Thank you. That money is divided between the Disabilities Council to provide community-based respite services and Inclusion NWT to provide respite services in Yellowknife. So the money is directed to nonprofit organizations with subject matter expertise to spend. Thank you.
Thank you. Member for Great Slave.
Yes, that's what I said. So my question is that been analyzed as part of the supportive living and to see if it's enough for people in the territory, or whether or not there's actually a greater need that hasn't been identified because people aren't aware that they can qualify for programs like that? Thank you.
Thank you. Minister.
Thank you, Madam Chair. The Deputy Minister will have the detail.
Thank you. Deputy Minister.
Thank you, Madam Chair. So respite services were part of the review for the supported living. There were 7 categories of the actual supported living review. So things such as the scope of the service, the resources that are required to provide those services, standards of care, oversight, access and equity, the workforce development, and so on. So ultimately, at the end of the day, it's not the review wasn't necessarily done to determine whether we need to specifically increase respite in and of itself, but it was captured within the part as a concept within the function and the purpose of the review within supported living.
Thank you. Member for Great Slave.
Thank you, Madam Chair. And I apologize if this has already been said or answered, but when can we expect to start seeing increases or a change to the way the funding is going here? And again, I think that there are more and more people that probably could use a lot of these funds and just aren't really aware. And so I'm glad to hear that there's a sort of a revamping coming, but when can we sort of expect to see that actually translate to work on the ground or to this changing? Thank you.
Thank you. Minister.
Yeah, thank you. The supported living review had 33 recommendations, and 12 of those were ones that we could begin work on without additional funding. So for the remaining 21 recommendations, we would need to develop them for the next business plan in order to obtain funding to implement them. Thank you.
Thank you. Member for Great Slave.
Thank you, Madam Chair. And does the Minister or the Department know whether or not, or can they somewhat anticipate if that would be part of this funding that's coming from the federal government that we already have been announced, or would we be looking for new funding for these changes, or something that would be restructured internally? Thank you.
Thank you. Minister?
Yeah, I'm not sure where the money's going to come from. I don't think it'll come from the new tailored agreements, tailored bilateral agreements. None of them speak to people who need supported living unless they're elderly and they need long-term care. So there's a question there about whether we can find an appropriate pot of funding from the federal government, or whether we will be looking for an increase in the budget from the GNWT. Thank you.
Member for Great Slave.
Thank you, Madam Chair. And is there any funding that's potentially coming from the federal government, or something we could access around Indigenous supports, particularly for people working in the communities or living in the communities, sorry? And the reason, again, I ask is that I'm aware of people that have had to move to Yellowknife in order to access the services here for their children, or to another regional center. And I guess my question is there some way to leverage attention from the federal government on Indigenous issues and reconciliation to get some money to sort of take up this area? Thank you.
Thank you. Minister?
Yeah, thank you. The money is offered to the GNWT as the public health provider, that is to say the public supplier of health care in the Northwest Territories. There has been some discussion about a health equity fund for Indigenous people, but the parameters of that have not been set, and I'm not sure if they would apply to the case that the member is asking about. Thank you.
Thank you. Member for Great Slave.
Thank you, Madam Chair. Does the department have the ability to input around this Indigenous Equity Fund conversation, or to at least facilitate that conversation between the federal government and Indigenous governments in the territory? Thank you, Madam Chair.
Thank you. Minister?
Yeah, I anticipate this conversation will take place between Indigenous Services Canada and the Indigenous governments directly, and we may or may not have a seat at the table.
Thank you. Member for Great Slave.
Thank you, Madam Chair. I hope that we'll have a seat at the table. I think always that any of the experience that I'm sure the department can offer would be well, something that would be good to input on. I'm sure you know a lot better than the federal government necessarily what needs to happen. I think that's it for me now. Thank you, Madam Chair.
Thank you. All right, so long-term and community care, if there's no other questions, please turn to page 203. Health and Social Services, long-term and continuing care services, operations expenditures, summary, main estimates 2023-2024, $67,960,000. Does committee agree? Thank you. Now we'll turn to out-of-territory services, beginning on page 207 with information items on page 208. Questions? Any questions? Seeing none. Please turn to page 207. Health and Social Services, out-of-territory services, operation expenditure summary, main estimates 2023-2024, $83,650,000. Does committee agree? Thank you, committee. We'll now turn to supplementary health benefits on page 210 with information items on page 211. Questions? Member for Frame Lake.
Thanks, Madam Chair. I'm looking at page 210, and the medical travel benefits line, there's quite a drop between 22-23 and 23-24, probably in the neighborhood of $5 million, or you know, it's like maybe 20% drops. Can I get an explanation as to why there's so much less money for medical travel in 23-24? Thanks, Madam Chair.
Thank you. Minister of Health and Social Services.
Thank you, Madam Chair, and thank you for the question. The Territorial Health Investment Fund has not yet been renewed for the 23-24 fiscal year, so it's not included in this budget. But in the previous fiscal year, we allocated $5 million of that fund toward the cost of travel, medical travel.
Thank you. Member for Frame Lake.
Thanks. I guess I'm trying to understand what the minister just said. So we anticipate having to spend less in 23-24 because we're going to get more money from the federal government for medical travel. Is that what I think the minister said? Thanks, Madam Chair.
Thank you. Minister?
Yeah, thank you. Since 2004, we've had a fund called the Territorial Health Initiative Fund, and we've used it for special projects like creating NTHSSA and starting the primary care health reform. But we've also allocated $5 million in the current agreement each year towards the cost of medical travel. So this agreement expires on March the 31st this year, and so we did not include that amount of money in the budget because we do not yet have an assurance that we're going to have an extension to the Territorial Health Initiative Fund or for how much money.
Thank you. Member for Frame Lake.
Okay, thanks. Maybe I'm just not getting this, but how much then do we actually expect to spend on medical travel in 23-24 then? Thanks, Madam Chair.
Thank you. Minister?
Yeah, so, I'm sorry that I'm not explaining it. We have federal money. We don't have assurance of how much it is, so it's not in the budget. Hopefully everything works out by the end of the month and it comes into the budget and we add it to this line. But the actual cost is what you see in the revised estimates for 22-23, $24,240,000. That doesn't include the NIHB amount. The total amount of medical travel is in the range of $43 million. Medical travel is an as and when situation. When people need medical travel, we pay for them to go on medical travel. And if there is not enough money in the budget for that, then we ask for a supplementary appropriation to cover whatever shortfall there is in our budget to make medical travel possible.
Thank you. Member for Frame Lake.
Okay, thanks, Madam Chair. So if this extra federal money gets sorted out in the next while, will it come back into the Health and Social Services budget then through supplementary appropriation? Is that the plan? Thanks, Madam Chair.
Thank you. Minister?
Yeah, thank you. Yes, that's right. It would come in through supplementary appropriation. Now all the money we receive on doing work on behalf of others is brought into the budget through a supplementary appropriation.
Thank you. Member for Frame Lake.
Thanks. Yeah, I guess I don't know. I know it's late, and I'm just trying to understand how we can only budget then $19 million for medical travel benefits in 23-24 when we anticipate spending probably even more than $24 million. How does that work? Like, why wouldn't we just actually budget the expected amount and show a deficit? Maybe back on the revenue side or something. I just don't understand how we spent $24 million last year. but we're only budgeting 19 for this year when we know we're actually going to spend more. I just don't understand how that budgeting works. Thanks, Madam Chair.
Thank you. Minister of Health and Social Services.
I think I'm going to ask the Director of Finance to have a go at this, and maybe that will provide more clarity.
Thank you. Ms. Johnson.
Thank you, Madam Chair. This federal agreement, we anticipated it being renewed. So in the past, when there was uncertainty, we did have it appropriated through the business planning process and then had to come back and have it reprofiled. So in this case, with the anticipated funding, it was just, it's not included in the budget, but anticipated through SUP.
Thank you. Member for Frame Lake.
Thanks, Madam Chair. I don't understand how this works, that we anticipate spending more money in this area, and I guess the hope is that somehow the feds are going to bail us out, but the proper amount hasn't been shown in the budget, so I don't think I'm going to get an answer. Thanks, Madam Chair. That's it.
Thank you. Are there any other further questions to supplementary health benefits? Member for Cam Lake.
Thank you very much, Madam Chair. Madam Chair, I wanted to ask some questions about the medical travel benefits. This is something that I know has come up quite a bit over the course of the term, and my understanding is this is quite common, and the focus of the questions largely have been around the amount that is offered to residents when it comes to medical travel, especially with the, especially in relation to per diems for the cost for food and the cost for accommodations. One of the issues that has come up and was highlighted was specific to the cost or the additional cost of somebody bringing kids into Yellowknife for the purposes of for birthing purposes, and so sorry. Somebody.
They started the clock on you now.
Okay.
Look out.
RJ. So somebody might not have childcare in their home community, and they might need to bring their kids with them, and are unable, if they bring their kids with them, it is considered more than one escort. Each child is considered an escort, and what ends up happening is they're denied government funded lodging, and they have to go and find their own place to stay. And so if they find themselves in a hotel situation, they're only reimbursed for the $50, and this is not representative of what it actually costs a family to stay in a hotel. The concern that's been raised to me is this ends up being not a culturally safe policy, and a lot of people might be in a situation where they just, because of their own personal histories, don't feel comfortable leaving their children with someone else and need to bring their children with them to Yellowknife or wherever they are having children. So I'm wondering if, while this amount of money is you know, $5,000 or $5 million less than what the department would like to see, is there an intent to revise some of the policy work around medical travel to make it more culturally safe for all residents of the territory? Thank you.
Thank you. Minister.
Yeah, thank you, Madam Chair. Madam Chair, as I mentioned earlier, there is a review of medical travel ongoing now, and the per diems are one of the areas that will be re-examined. In terms of bringing additional children with the family when they are coming in for the birth of a child, I would recommend that the family contact Child and Family Services and explore a voluntary services agreement to pay for the cost of the additional children coming in to Yellowknife. I realize that the member is now going to say that's not culturally safe and people don't want anything to do with Child and Family Services, but we don't have another way of assisting families unless they have their own ways of raising money. Thank you.
Thank you, Minister. Member for Cam Lake.
Thank you very much, Madam Chair. Madam Chair, does the Minister have an idea in this area how much residents are relying on Jordan's Principle to fund some of the shortfall of the GNWT in order to make medical travel more accessible for people who do need to bring their kids with them and don't, because this really ends up being a access to health issue or equitable access to health issue. Thank you.
Thank you. Minister?
Thank you. We don't have any information about Jordan's principal spending in this area.
Thank you. Member for Cam Lake.
Yeah, thank you very much, Madam Chair. And this is not a comment only directed at the health minister, but I think all ministers is, I think we really need to have a better idea of what supports Jordan's principal is supplying to the GNWT, because I think that it is far greater than any of us actually realizes. And my concern is if those supports disappear, we will be really struggling in our territory. So I think it's important that we have an idea of what that dollar figure is. Thank you, Madam Chair.
Thank you. Minister?
Thank you, Madam Chair. Thank you for the comment.
Are there any further questions, comments under supplementary health benefits? Seeing none, please turn to page 210. Health and Social Services Supplementary Health Benefits Operation Expenditure Summary Main Estimates 2023-2024 $35,321,000. Does committee agree? There are additional information items on page 212 to 216. Are there any questions? Seeing none, please, members, please return now to the departmental summary found on page 181. Revenue summary information items on page 182 and 83. No further questions, committee. I will now call Department of Summary of Health and Social Services Operation Expenditures Total Department 2023-2024. Main estimate $610,276,000. Mr. O'Reilly.
Thank you, Madam Chair. I move that the committee defer further consideration of the estimates for the Department of Health and Social Services at this time. Thank you.
Thank you. The motion is in order. To the motion. Question has been called. All those in favor? All those opposed? Motion is carried. Consideration of Department Health and Social Services 2023-2024 main estimates operating expenditures total department is deferred. Thank you, Minister. And thank you to the witnesses for appearing before us. Sergeant at Arms, please escort the witnesses from the chamber. Member for Frame Lake.
Thank you, Madam Chair.
Thank you.
We have to wait for them to leave, or I move that the chair rise and report progress.
There's a motion on the floor to report progress. The motion is in order and non-debatable. All those in favor? All those opposed? The motion is carried. I will now rise and report progress.
Oh. Order, order. May I please have the report of Committee of the Whole, member for Inuvialuktun Lakes.
Mr. Speaker, your committee has been considering table document 813-19 brackets 2, 2023-2024 main estimates. And I would like to report with one motion pass. And Mr. Speaker, I move that the report of the Committee of the Whole be concurred with. Thank you, Mr. Speaker.
For Inuvialuktun Lakes, do we have a seconder? Member for Cam Lake, all those in favour? All those opposed? Any abstentions? Motion is carried. Third reading of bills. Third reading of bills, Mr. Clerk, orders of the day.
Thank you, Mr. Speaker. Orders of the day for Tuesday, March 7th, 2023 at 1:30 p.m. Prayer, minister statements, member statements, recognition of visitors in the gallery, reports of committees on the review of bills, reports of standing and special committees, returns to oral questions, acknowledgements, oral questions, written questions, returns to written questions, replies to the Commissioner's address, petitions, tabling of documents, notices of motion, motions, notices of motion for first reading of bills, first reading of bills, second reading of bills, Bill 64, Bill 72, Bill 73, consideration in Committee of the Whole of bills and other matters, Bills 23, 29, 60, 61, 63, 66, 67, and 68, Committee reports 40, 43, 44, and 45, Minister Statements 264, Table Documents 681, 694, and 813, Report of Committee of the Whole, third reading of bills, orders of the day.
Mr. Clerk, this House stands adjourned until Tuesday, March 7th, 2023 at 1:30 p.m.
Order!